It's I'm just going to talk over you now, Tyler, if you keep talking over me all the time.
But just stopping a hormone, and like you said, if you don't have the hysterectomy, it's going to put you back pretty much to where you were before.
That is not true. Why? What is wrong with you? What is wrong with you?
And I asked them how they can determine, or how is there any way to determine the difference between a kid who's going to grow up to be cis and a kid who's going to grow up to be trans. And I was kicked out of the conference for asking it.
That's the last thing you want to be, is like well-meaning but ignorant. Just don't be an ally. All of you allies, stop. Be friends with some trans people and just be there for them. Stop this ally shit. You're not helping anyone.
Do you have any evidence of WPATH being so negligent that they like actively want to just see kids getting harmed?
They don't want
WPATH files. Go look it up.
right or cancer that is like spreading and proliferating in their body. So, and,
the analogy,
I'm not saying that we should get rid of
trans your kids, guys.
I love you, Mary.
All right, we're going to watch this whicktv panel. Erudite / soy pill versus Tali / Aaron.
Welcome, one and all, to yet another episode of whicktv. It's a cross-ideological space where we come together to talk about issues both political and cultural, from the silly to the serious. And today, we're going to be talking about trans-affirmative healthcare. Is trans-affirmative healthcare life-saving? Is it medically necessary? What does trans-affirmative healthcare
I wouldn't say it's either of those things. It's much more body modification than anything. Seems to help some people's mental health, doesn't seem to help other people's. Calling it life-saving is automatically a bit ridiculous, I think.
even mean? How has it been handled? We're going to go through it. We're going to talk about it. And we got a great debate today with some great people. I like every single person on here. I don't know you, Aaron, but Tali likes you, so I like you too. And we'll just get into it. I'm going to give first the mic to Soy Pill, and then we're just going to go around the room. Soy Pill, start us off. Give us what you got.
Yeah, basically my position is trans people exist. I live in San Francisco. I keep tripping over them every time I go on a walk. And the data that I've looked through, studies and otherwise, surveys, quality of life stuff, seems to show that gender affirming care is a positive treatment that has a good effect on suicidality, gender dysphoria, and just overall mental well-being. It's interesting because I think a lot of people...
Yeah, bear in mind, a lot of what he's citing is not going to be amazing quality evidence. It's going to be a lot of, are you as suicidal as you used to be? No. Okay, well, chalk that up. It's often not great. It's often not great evidence. And the evidence tends to be quite mixed.
People don't talk about this spectrum of gender affirming care in this conversation. Everyone just kind of thinks, oh, you get a bottom surgery or not, where it seems to be a spectrum of anywhere from surgery all the way back to, hey, I just want to change my name and present a little differently. And both of these things fall into that umbrella.
Changing your name and presenting differently counts as gender affirming care. I can't bring myself to agree with that.
And both of these things seem to have positive outcomes. So I've looked at the people that kind of oppose this, and upon scrutiny, it seems like the data is misrepresented or neutral at best. So just given the evidence that I've been able to analyze, and also, although I don't want to use this as very strong evidence, my anecdotal experience living in the trans mecca of America, it seems like gender affirming care works and it helps the people that are asking for it. So I support it as a life-saving measure that reduces suicidality, and people should have access to it.
It's important to remember, reducing suicidality, I don't think that's really enough to call something life-saving. Suicidality and suicide aren't the same thing. Just means you feel a certain way. It's like one up from like depressed. So it's very difficult to like form tight conclusions on this kind of stuff when what we're talking about is like quite nebulous. Like suicidality is quite nebulous. It doesn't mean that you're going to commit suicide necessarily, you know? Changing a name and having a different hairstyle makes people less suicidal. It kind of seems like he's implying that. Listen, hopefully we'll get into it and see what he really thinks.
Okay, well, thank you for being here. I'm sure we'll get into it as we go. Aaron, tell people who you are, what you do, and what are your thoughts? Go ahead.
Awesome, thank you. So my name is Aaron. I co-host a podcast with Tali Bots here called The Navel Gaze. I am myself a transgender man. I transitioned in 2000.
Interesting how often the only trans person on the panel often isn't anywhere near as like stereotypically trans positive as like everyone else. It's funny.
11 or 12, I can never remember which one. But anyway, a little over a decade ago. And all in all, fits exactly what Soy here was saying. Improved my quality of life. I was very happy with having the ability to transition, and did what it said on the tin. And I just proceeded with my life quite happily for the next 5 or 6 years until around 2017, when I encountered a number of fellow FTMs, females who were either trans-identified or male-identified, living as men or trans men, etc. Many of whom expressed that their transition was motivated by a desire to be trans, not to be male. They didn't actually experience gender dysphoria. They just felt that they...
Yeah, I think so far we've got a similar perspective. It can help some people. Some of the people receiving it arguably shouldn't be and are in it for the wrong reasons.
That basically there was some sort of social good. These aren't the words that they were using, but it was clear that from what they were trying to express, that they had essentially joined a social movement, and transition was what you do to validate your involvement in this social movement. And they were quite kind of alarmed by me stating that I actually wanted to be a man, and I thought that I should be a man. Was like, the typical experience of gender dysphoria. They were kind of like freaked out by it, and it was like, oh, that's just kind of what...
Oh, you're reinforcing the binary. Oh, it's cis heteronormative, whatever.
You tell cis people in order to gain access to this,
Yeah, so you've got Aaron and Tali bots, and then Erudite and this soy pill person.
To trans healthcare. Anyway, so learning, these are people that I encountered in my real day-to-day life. And so I went back online into the kind of trans sphere and realized that the things that they were saying had become quite commonplace. So yeah, a lot of young people. These are people between the ages of 21 and 25 that I was encountering, who were transitioning to be trans, and that was again quite alarming. So I just started to re-immerse myself in the forums. Started just kind of like trying to.
I guess what we're saying, like transitioning to be trans, like taking on that status, gaining access to a community. I think there's too many people out there that get into something like trans, possibly even end up getting into something like detrans. All kinds of other things, largely for the community, which is not a good thing. Like, you should never be doing that kind of thing due to other people or for other people.
To figure out what it was that had gone wrong, like what is happening here. That's when I encountered Lisa Littman's work on rapid onset gender dysphoria, and it was describing exactly what I was seeing in these young women and or young trans men. And so I was quite relieved. I was like, okay, sweet.
Wonder if either of these people will say that the Lisa Littman thing has been debunked. Wonder. The thing is, ROGD has been like perfectly described by people like Marcy Bowers. Marcy Bowers in that Brianna Wu debate at one point perfectly spelled out something like, well, we've got this cohort now of like younger females that are just appearing, identifying as trans out of nowhere, don't seem to have any history. Perfectly spelling out ROGD. Even someone like Marcy Bowers seems to think it exists these days.
The professionals are aware of this and are looking into it. Anyway, so then I got immersed into the more gender critical sphere, and anyway, just started talking about the experience of being trans in the light of nothing, or it isn't all what it seems behind the scenes, essentially.
Okay, well, I'm sure we're going to get into it as we go. Thank you for being here, right? I didn't mean to cut you off there, but like, we're already late, right? So, we got to get through. These are just opening thoughts.
Wait, they were already late. They were waiting for Erudite, weren't they? Fuck me. Anyway.
Erudite, welcome to the show. What are your thoughts? Trans affirming healthcare, yay or nay?
Hello. Yes. Thanks for having me. I think the trans affirming healthcare is a complicated question. And I think I'm excited for the conversation because I saw Tali speak before. I think she's extremely capable. So I'm excited. But it seems like the opposition is also really, really informed. So I suspect that this is probably going to be a lot less blood sportsy. One of the things that I keep hearing is these elements of the nuance within the community that is probably being underserved both at research and in communication, right? I think what Aaron, am I using your name correctly, Aaron? I think what Aaron brought up about the rapid onset individuals versus there's also a cohort that typically seems to notice their dysphoria at puberty, but not before, versus individuals who at about 2 to 3, like basically as soon as they can verbalize dysphoria, are verbalizing the dysphoria. And there's kind of these 3 categories of individuals that we see, maybe potentially more, and they kind of all get broad brushed as the same treatment modality. But also, as Soipo pointed out, gender affirming care is spectrumal as well, which is good because
I need to see an example of either of these people's like homophobia. I don't know if I agree, because I guess I probably haven't seen what you're seeing. It's been a while since I've watched anything involving either of these two people, so.
if it's a spectral disorder, it should probably be spectral in its care. And so I am pro gender affirming care. I think that trans identity is neuropsychological, but also neurobiological.
Okay, what are we saying? Trans brains kind of stuff? Neurobiological? Like how?
However, there are ways in which neurobiology is plastic, and it's important to kind of understand all of these elements. I do think that gender affirming care seems to overall lead to a better outcome for the trans individuals that undergo the procedures and the treatments. It leads to higher quality life, less dysphoria, less time off work, et cetera, all the markers that we look for functioning and flourishing. So I am pro GAC, gender affirming care.
Hey, thanks for being here. Really appreciate you coming. Last but certainly not least, the person responsible for this panel, because she asked me to set it up, Tali, what you got?
Okay, I will try to be concise, but as I told our opponents last night in our group chat, this is a topic that I care a lot about, and I'm really excited to be speaking with the two of them because I think they're thoughtful and smart, and I'm hoping that I'll actually be able to change their minds in some way. I think we're starting with the same outcome in mind, which is for people with dysphoria and trans people to have happy, well-adjusted, successful lives and to have access to medical care that is helpful for them and that they can understand. The reason that I'm against gender-affirming care, number one, is because ultimately
this is the most firmly against stance, I'm guessing.
They don't actually know what they're treating. And so I'm not against hormone access. I'm not against surgical interventions for trans people. I am against the system that functions on very low to moderate evidence at all and kind of tells people or sets people up with expectations that are not always realistic and that are not always informed about what the actual long-term outcomes are. I know we're not focusing exclusively on children here, but gender affirming care in the standards of care from WPATH, the World Professional Association for Transgender Health, does include youth gender affirming care. And there are even more concerns that I have about that and our ability to actually determine who is going to benefit from this care long term. So not only do we have the issue of people who detransition, who might have regret for the interventions that they had, we also have people who go on to continue to identify as trans for the rest of their lives, who have regret about some of the interventions that they had. Gender affirming care in some cases can actually limit the potential for different surgical outcomes in the future, which was something that it was attempting to control for, especially when we're talking about early intervention and youth intervention. And so ultimately what I want is for trans people to have the most informed care possible. And I don't think that the infrastructure that we have today is doing that. I don't think it's a conspiracy. I think most clinicians and doctors who work with this population believe they are doing what's best. But I think there's been unfortunately, a real capture of the academic research amongst activists. And that is to the detriment of those individuals and the trans community at large.
Okay, well, thank you for being here, and we will get into it as we go. Well, that's the floor. That's the setup. I guess first question, right, that we have to ask. Gender affirming care.
Okay, it was a quick one, I guess.
Care. A lot of people have said and claimed that it's being pushed, and Tali just mentioned it's being pushed by activists, right? That a lot of people are being pushed to be trans who would otherwise not be trans, and they go through procedures, take hormones, and do other things that they come later to regret. Do we agree with this? Do we disagree with this? I want to hear from Soypill and Erudite first.
So it's the question that there are people who may otherwise have not self-identified with some sort of gender dysphoria, but because of the community at large kind of making this a positive movement, people would otherwise fall into that camp, kind of what Aaron was describing. Is that the question?
Yes.
I don't think there's a huge amount of that. I think if you look at the CAST report, they kind of indicate that the exponential growth of people identifying as trans is kind of more than what would be expected, although there are refutations of this. And I'm not quite sure to what extent that is happening, although I can for sure, like anecdotally.
Like, we have to know that the demographics have changed a lot recently. There's many more people. And people will say, oh, it's because there's more like awareness of trans, but that's part of the problem. More people are aware. More people are likely to take on trans identity when it doesn't work for them, when it's not what they should be doing, you know?
Say that, like I said, living in an incredibly progressive area, I do know people who have verbatim told me I was bored of being cis and not having anything to do with transition as a gender dysphoric thing, but rather, you know,
Like, bear in mind, this is an extreme example. These are the people that literally will say like extreme shit. They just treat it as like disposable or whatever. Plenty of other people will say all the right things. And then just however many years down the line, suddenly they realize it wasn't actually for them to begin with. And they've changed their mind on a bunch of stuff.
Wanted to be trans or I wanted to be different. I'm sure this does happen. To what extent that's harmful, though, is a completely different question, because these people, again, are not incredibly, in pain or unhappy. They seem to be happy from my knowledge. And I guess the question...
This is a bit strange. Like, to what harm it's actually doing people taking on trans identities erroneously. Well, what changes they're making to their bodies? Are they going to decide they wish they could have had kids later down the line, and this is something that's affected their ability to? The harm is like any kind of ultimately unwanted effects from the supposed care that they had, no?
Question is, and maybe this is something Holly
Aaron just seems to want to pull up the ladder after to had open access themselves. I mean, I need to hear more from him. I don't know whether that's true. People can say the same about me. They probably will. But I'm not like fully against it. You know what I mean? I'm not like, you know, there still should be gender affirming care. Like, get rid of it for minors, absolutely. People pretend to forget previous social contagions and disregard the idea entirely. Yeah, that happens. We'll hear about like social contagion and stuff, I guess.
agrees with. If these people are seeking some sort of gender affirming care based on both the WPATH and the Endocrine Society and even the CAS report, they kind of recommend a holistic, multi-stepped, multifaceted approach from doctors and psychologists to make sure that you do indeed want something that is a very serious, potentially irreversible thing like a surgery. If that's indeed the case, then if some of these people are socially contagioned, so long as they meet the criteria, I think it's fine. And they think that the people that wouldn't irreversible thing like a surgery, if that's indeed the case, then if some of these people are socially contagioned, so long as they meet the criteria, I think it's fine. And they
meet the criteria. What are the criteria, though? Most of it's just about saying the right thing, isn't it?
Think that the people that wouldn't be suffering from gender dysphoria wouldn't meet those criteria and therefore wouldn't be harmed because they're not getting some sort of irreversible change to their body.
Like that I think is bullshit. I'm sorry. See, sorry, I'm skipping back a lot. I need to make sure I'm hearing what I think I'm hearing.
So long as they meet the criteria, I think it's fine. And they think that the people that wouldn't be suffering from gender dysphoria wouldn't meet those criteria and therefore...
That is just not true. If you're trying to get gender affirming care, you probably know what you should say. If you're a social contagion case, you've already got a friend or someone or other who has been through it, who you've probably taken on some of the language and the rhetoric of, you know what I mean?
Therefore wouldn't be harmed because they're not getting some sort of irreversible change to their bodies.
Can I jump in?
Yeah,
Yeah, that sounds very naive, I think.
Go ahead, yeah.
Okay. So I partially agree with you, and I even want to take some of the loading off of terms like social contagion and like the groups like Gays Against Groomers, for example.
Criteria is them saying I'm trans. Yeah, that's what I mean. Anyone can meet the criteria. It's more or less the same for any like condition, any psychological condition. If you want antidepressants, even if you're not depressed, you probably know what you should say in order to get them. You're meeting the criteria, but it's still not right for you. You know what I mean?
As a gay person, I don't associate with any of that messaging. I don't think that trans people are out there trying to recruit cis people to turn into trans people. I don't think any of that is happening. I think rapid onset gender dysphoria and the social contagion that people like Abigail Schreier have written about is much less nefarious. It's much more kind of like, especially when we're talking about the young females, it's women having very emoting very relationally, feeling and taking on very strongly what their friends are taking on. It's also potentially an example of like the symptom pool where people are actually experiencing distress. So these kids are actually extremely anxious, extremely depressed, might have issues with their own body. And when they look up like what does this mean, trans is the answer that's given to them. So I don't think that this is like some conspiratorial push to make the frogs gay or make the kids trans at all.
Yeah, I wasn't accusing you of that, but I'm saying...
Sorry, watching Wake's jaw go up and down is driving me insane. We're going to cover him for a bit.
That it is like a movement that some people feel not pressured into or like even groomed into is such a silly word, but people that like might adhere to something that turns out not to be gender dysphoria, which is why sometimes you see when you poll people who detransition, some of them say it's because of not enough acceptance. I think that's the majority. Over 50% say it's because my community didn't accept me.
Well, these are only the ones that are polled, though. Quite a lot of detransitioners just kind of disappear and stop talking to anyone about any of this.
But some of them say like, hey, I thought I was.
And like how many of them might be like, oh, well, shit, I have to give a reason that doesn't potentially affect other people's access to gender affirming care. I think there's a lot of that mentality around, but obviously it's difficult to prove that.
And then it turned out it wasn't that, and that's totally fine.
I think what I'm basing that on more is how like politicized and like radicalized a lot of these groups are, and how whenever you hear about someone detransitioning, you've always got these people lining up to say things like, oh, well, detransitioning is fine, but don't attack trans healthcare. You know what I mean? That seems to be on the forefront of their mind. They don't actually care about the person who's detransitioning. They care about how it might actually end up affecting them or people like them, which is a bit gross in my opinion.
Word, but people that like might adhere to something that turns out not to be gender dysphoria, which is why sometimes you see when you poll people who detransition, some of them say it's because of not enough acceptance. I think that's the majority, over 50%.
I doesn't think something is absolutely happening. Do you mean the kind of recruitment stuff? I think I would say I'm sure there's like examples of that out there. I think what she's saying, like in terms of social contagion, that's probably not quite the same. Like social contagion between like teenage girls or something, it's not quite the same as like recruitment. It's like getting into something because your friend's into something. You know, I think it's a little bit, I think she's saying that it's a bit of a different thing to how it might be framed.
50% say it's because my community didn't accept me, but some of them say like, hey, I thought I was, and then it turned out it wasn't that. And that's totally fine, especially when it is like, hey, I got on puberty blockers and I went off, or I took testosterone for 6 months and realized
I went on puberty blockers, then I came off. Like, well, what are the effects of that? Is it really normal to just pause your puberty and then just resume as if nothing ever happened? I'm just not sure about that. Like, there was people that were like suing Lupron for like effects they were having years later.
wasn't that, and that's totally fine, especially when it is like, hey, I got on puberty blockers and I went off, or I took testosterone for 6 months and realized, you know what, I don't think I have
Took testosterone for 6 months and then went back.
gender dysphoria.
How many of those people get like irreversible effects by then? How long does it take for an FTM taking testosterone for their voice to break, for them to start growing facial hair, for them to get some kind of skin condition potentially, because I know it can affect your skin, to start losing their hair? How long did it take that Casey Miller person? How long were they on testosterone before their hair started falling out? Very quickly.
That seems fine.
Like, that seems fine. Like, it's just, oh man, it's gonna be painful. It's gonna be painful. The worst ones are the well-meaning ones. The worst ones are the well-meaning ones who just see some evidence that it's all hunky-dory, it's all fine. Oh, well, you just take something, it's fully reversible, it's fine. Don't worry about it, it's fine, it's fine. It's kind of the next step evolution from the retard trans ally who's always just like, oh, who cares, bro? Who cares? Like, who cares? Oh, someone took some testosterone for a bit and then they came off it. Like, who cares, bro? Why do you care, bro? It kind of seems like the evolution of that, you know what I mean? And it's painful to listen to.
So the reason... Oh, sorry.
Go ahead, Erudite.
Okay, yeah.
Erudite first, then we'll go to Tali, please.
I was just going to kind of like bridge. I think social contagion, particularly from social media, is something that's kind of going to be understudied for a while. This reminds me, this is very akin to the Tourette's conversation that emerged during COVID, where a lot of like 13 to 15-year-old girls were showing Tourette's symptomology, but it was around the same.
Yeah, the shit like this is more one-to-one in many ways. When I watch, you get people that are making like videos about like the TikTok Tourette's craze or the DID craze. And they like literally one-to-one made the same exact argument that people are saying about like trans crazes on TikTok. And sometimes you'll see someone who like, oh, I thought I had 23 different people living inside of my head, but actually no, I'm trans. And it's like, that's like an improvement, when actually they seem to be doing the same thing, just in a different direction, just finding something that's a bit more socially acceptable. Some of these people that talk about like these TikTok mental health crazes, if they looked into some of this trans shit a little bit more, they'd be making the same video about trans people. But I bet most of them never would, because they know what would happen.
Same time that Tourette's TikTok was really popular. People just really enjoyed like watching cute Tourette's teens making cookies and spilling things all over the place and just doing little silly little antics, right?
Well, people pretending to have Tourette's largely. I mean, who are we all thinking of? That Ticks and Roses person. That person was full of shit. They were pretending. It was like acting. DID. It's all like basically turning yourself into some kind of creative writing exercise. It's bizarre.
And there was this interesting phenomenon where we did see an increase in...
Yeah, the DID craze is gross. Plenty of the same people have all these gender identities. For some reason, almost all of them, all their alters have all these different pronouns and identities and stuff. These things are nowhere near as far apart as people pretend. It's just that the DID thing is more obviously ridiculous. You know what I mean?
In Tourette's presentation. The issue is that most of it just resolved pretty quickly when you like removed access, or if you just like kind of like countered them on it and being like, do you have Tourette's really? Like the moment that like some of the self-analysis was applied, you saw a massive diminishment of those symptomologies. The interesting thing though...
Well, is that because they were getting challenged, or do they move on to something else? At one point, it stopped being trendy to pretend to have Tourette's. Now I have to pretend to have DID, and there's 23 different people in my head. Better change my wig and my costume because someone else is beginning to front.
That wasn't the case for all of them. And so there's this interesting question of, okay, well, to what degree is the people that were lumped into the study as the contagion group, to what degree were they always going to develop Tourette's? To what degree is Tourette's epidemic?
I've seen multiple people with DID who transition because one of their alters is the opposite gender. I've seen something in the WPATH files. It was someone asking, I have this patient presenting with DID. I'm struggling to get the consent of all the different alters to transition this person. And like people recommending things like, oh, just talking to them one by one. When it's like, they have all these different identities, they have all these different things. Why would you transition them? That is like nuts to me. And that's an example of where, yes, we probably do actually need a bit more fucking gatekeeping.
Genetic enough that social media can be an environmental trigger that triggers these type of genetics. And I think that there can be this akin question to transgenderism, because I do think fundamentally transgenderism is a neurobiological phenomena. I think there is
genetics. Is any of this supported by anything?
Social media can be an environmental trigger that triggers these type of genetics.
Triggers these genetics. What are we basing this on?
And I think that there can be this akin question to transgenderism, because I do think fundamentally transgenderism is a neurobiological phenomena. I think there is evidence for it occurring within the brain and at the brain level.
Yeah, there's evidence for it. Often tiny sample sizes. Often convenience samples. Often stuff that could very well be explained by neuroplasticity, by the brain being affected by what kind of activities you partake in, what kind of people you're around, how you socialize. There just isn't really any solid evidence for the trans brain stuff. And it kind of hinges on the fact that a person's gender identity is anything at all. When any of these people might come out as actually not trans after all in 5 years or something, meaning that that one particular result is completely wiped off. You see similar things in like gay men and more effeminate men. So does the gender identity have anything to do with it whatsoever?
But if that's the case, in the same way with like even something like schizophrenia, if it is the case that it is neurobiological, there are neural correlates for it. This does mean that environmental stimuli can potentially trigger it in the way that certain weed consumption, if you have a genetic marker for it, can trigger schizophrenia and it will be permanent. And I think that that's a really interesting conversation to have. The issue is that it's a very, very, very teeny tiny amount of the population compared to, I think, what typically we talk about when we're talking about contagion behavior.
I need more info on what Erudite is saying to not just dismiss it as kind of pseudoscientific, you know? I know the brain scan studies. I've seen plenty of them. They're not very good in general. They're not very good. They don't conclude a whole lot of anything because there's too many other factors. And to me, it seems like you could take gender identity out of the equation and take far bigger samples of just like trans women, effeminate males, gay males, and you'll probably see potentially similar results. And that gender identity really has nothing to do with it and would suggest that actually it's not a factor. But like there's only so much we know. Like I think neurobiology in particular, neuroscience is like in its infancy, isn't it? We understand far less how the brain works than other parts of the body. Yeah, this is not based on enough. I'd need to see way more info on what is informing this person, you know?
Charlie, you had something to say, and then I have another question to maybe move this a little more contentious.
So I think I want to pick up on the neural correlates thing, but I'm going to put that to the side for now and just get back to something that Soyapil was saying. So when we're looking at things like the CAST report and then also looking at gender affirming care in the United States, frankly, unfortunately...
Yeah, the other thing is, why doesn't WPATH say get your brain scanned? Why is there no real talk of any of that kind of stuff? There's no application for this, even if Erudite presents evidence.
We don't really have the same systems. And the UK, where the CAST...
Some people are susceptible to something like drug use triggering schizophrenia, but I don't know how this has anything to do with this. Well, Erudite just seems to be postulating that there might be a similar thing that happens in trans people, but it has to be based on something. It's all very well just coming up with something like that. What gene are you talking about? Have they found one? I've not heard of that, but sure.
CAS report where they needed to initiate the CAS report and take a look at what they were doing because the outcomes that they were having were not what they had expected. They found that it was severely lacking there, where it's much stricter than it actually is in the United States. So because we don't have we don't have the NHS, we don't have one central healthcare authority. We don't actually have ways of tracking these things or making sure we're not holding any clinicians to account for whether or not they are holding to the standards of care from WPATH. WPATH has its own issues. So the problem is, and it sounds like I'm not giving any opportunity for a win here, but not only is there no consistency in the United States among providers of how they are implementing standards of care, the standards of care themselves are severely lacking on the evidentiary grounds. And so what is the problem if someone goes in and they later find out that it's not for them? Well, the problem can be severe depending on the sex of the person.
Yeah, when we say like lacking in evidentiary grounds, that's something I'd expect the other two to like contest. It is and it isn't, because there's plenty of like research that they base this stuff on. It's about how good quality this research is and how well you can use it to actually come to conclusions about what we should and shouldn't do, you know? And that's a major thing that the CAS review brought up, is how low quality a lot of evidence is for like trans care. Talking about things like lack of follow-up, lack of blinding, sometimes tiny sample sizes or convenient samples, things like that.
And how much intervention they had. And also just the fact that we're framing this as necessary medical care, where I think, again, I'm for trans people having access to this care. I think it's better classified as body modification, elective plastic surgery, things like that.
Yeah, Rusty, I think wasn't that what Joanna Olson Kennedy was doing? That recent study, there was very little change in these kids' mental health when they were put on puberty blockers. And they spun it to me to be like, well, it doesn't seem like it's not helping, you know, something like that. I'd have to look at it again, but.
And I feel like people should have access to them, but not under the premise that this is going to save their life or really improve their quality of life all that much, because we don't have hard evidence to prove this.
We do, though, right? One of the biggest issues, I'm not sure if you're familiar with the Yale review of the CAS study, but the Yale review is done in large part, I don't think by WPATH, but I believe that there are people that have worked under WPATH in America for a long time. And one of the issues...
Wasn't Jack Turban involved in the Yale review? He's an interesting character.
That CAS review specifically has is the standard of evidence that it calls good evidence is well beyond the standard of evidence that we actually utilize in clinical practice, right? Because when it comes to medicine and clinical practice, we typically look for even low to moderate evidence before we begin implementing trials and whatnot to help people. Because in the case of clinical care, right, if anyone's had a doctor and they've looked at you with IBS and they're like, not really sure.
I think one thing I will grant, it does kind of seem like, especially with like mental health conditions, quite a lot of treatments are in fact based on like weak evidence. But then I don't know how many of them are being applied to children, you know what I mean? When it comes to like drugs and stuff. You don't really give kids like SSRIs and stuff like that. But we are applying this kind of thing to children. I think just because it doesn't work for other things, that isn't an argument for, well, it should be acceptable that low quality studies are used to affirm trans. Like, that criticism is saying, well, they are low quality, but we still use that kind of thing in other ways. Well, they're still low quality then, aren't they? They're still low quality. And the CAS review specifically, the focus was on trans care for kids, where surely you have to be way more careful, you know what I mean? It's for kids. It got sparked by the Tavistock clinic and all the shit that was going down with them. Someone suing them because they were treated inappropriately, and they shouldn't have been. So yeah, not blown away by this.
Sure. There's, just so it's clear, the treatments of IBS, very weak evidence for most of it, but the doctor is going to make almost all of those recommendations.
The other thing is IBS is like it's a condition that manifests in a very obvious kind of way. It kind of is what it is, irritable bowel syndrome. You can kind of infer what the thing is there. Trans is a lot less kind of clear as to what it even is, especially when it seems to differ so much in how people become trans, how it manifests, what they claim seems to be helping them, what their like goals are when it comes to transitioning.
And continue the process of trying to give you care, because even though there might be like weak access or weak evidence, and typically It's not that it's weak evidence. There's about medium to low evidence for gender affirming care, even for youth, but especially for adults. The evidence is really high for the massive limits that emerge in the nature of the care itself, right? RCTs are almost impossible.
Treatments for IBS don't do any harm to your body. I mean, I need to confirm that. But yeah, I mean, trans kind of sits apart. It's not something, I wouldn't compare transition to something like IBS. They don't seem very conflatable or whatever.
To do with gender affirming care, because, for example, none of these studies can be double blind, because if you're getting estrogen and you're a man, you're going to know if you have placebo or not, because your tits aren't going to grow, or they will. And then all of a sudden you're not double blind. And if you're not
Even then it's variable.
Not double blind, you're not going to have, and you're going to have a crazy attrition rate, because if you're not growing the tits.
Like, I understand her point, but just because we can't do certain things that would mean that the studies are high quality, does that mean we should then treat the lower quality studies as high quality? Does that mean we need to like be a bit more like, what's the word I'm looking for? Discerning. Well, I don't know. This isn't really a defense of trans care. It's just making excuses, you know.
In 6 months, and your cohort is, you're going to be like, oh, I'm on placebo. Fuck this shit. I'm out. I'm going to go try a different trial, right? And so, like, the standard of evidence that Cass is demanding is well beyond the standard of evidence that we require.
Yeah. Has anyone ever been like sterilized by their treatment for IBS? Has that ever happened? I don't know.
For any other type of care. And we can maybe have a conversation about, like,
I'm someone with IBS. Most treatments are vitamin-type tablets, controlling stress levels, and cutting stuff out of your diet. They don't really carry any risk. Okay, fair enough.
How we improve quality of care for trans kids, because I'm all for that. I'm very, very for that. But I think we have to be very honest and fair and even-handed in how we evaluate trans care, and not put trans people and trans workers at a higher standard of expectation than we have for anybody else.
I would massively disagree with this, especially with kids. I think when you're doing it to kids, it needs to be like airtight, doesn't it? Because it's much harder for a kid to consent to something when actually with their body there's nothing wrong, and the alternative there is just allowing them to develop naturally. Like, I'm not down with this. I'm not down with this.
Just because it's a politicized topic.
Like comparing transition to taking aspirin. Hey, maybe.
Thing is, though, we're not putting trans people at a higher standard. We're putting the specific medical interventions at a different standard than we would. So interestingly, I have a friend, might be a strong word, but an acquaintance of mine who I get along with and talk with a lot on Twitter, who is a trans woman, who is a gastroenterologist, and she's like a highly regarded specialist in the field. And she and I have had very similar conversations about exactly what you just said, Erudite, right? About the low to moderate quality of evidence for a lot of IBS and IBD treatments. And that doesn't mean that we deprive people of these treatments. But again, we're talking about the intensity of the intervention, right? So we would have different standards for intervening with, something like Prozac, right? Some type of like low dose of Prozac versus open heart surgery. And those are two extreme examples, but it's not that different from what we're talking about here. Trans interventions, medical interventions, many of them are completely permanent and life-altering. They are much more serious than, trying a diuretic, right?
Ken Zucker already had 30 years of clinical experience, which demonstrated that watchful waiting or allowing children to grow through to complete their full puberty, majority grew out of it. Yeah, there was Zucker. There was quite a few of them. There was that meta-study, wasn't it, that concluded, between 60 to 90 something % of these kids might desist if they just go through their puberty. There's nothing behind it. Children go through phases. Children identify as all kinds of things, think they're going to be all kinds of things. They change their mind. That's very normal. Like, I would need a heck of a lot more than what we've been given so far, especially for like kids. Like adults, because they can consent and because they are capable of understanding what they're putting themselves through voluntarily, I don't support like banning like trans care for like adults. But for kids, we can't just say, oh, well, we can't get very high quality evidence, so this is what we have to go work with. Well, then maybe it's just not to be for children. You know what I mean? Maybe it's just not meant to be. Maybe it's just not the right call.
To help with your IBS for some short-term period of time. And so I do think that, yes, we can't throw away all of the healthcare for trans people just because the evidence is low to moderate, but we absolutely do need to have different standards when we're talking about such intensive intervention.
You had a question, Soypil, go ahead.
Right. Well, one, I wanted you to clarify the idea of like most, you said most or a lot of this is irreversible. I think like of the gender affirming care treatments that I know of to be like permanent, I think surgery is obviously the one everyone thinks of. But like even puberty blockers, hormones, like all of these things, while they might have things that don't ever go away, the idea that they are like these.
Are we seriously about to say that in general hormone therapy is reversible? No, you can't do this, man. No.
Permanent life-altering things that require like this super extra scrutiny where we still allow lots of other like.
And it's not even just this, by the way. You also have to think of the fact that you start with this thing, you start with this treatment, socially transitioning, makes them overwhelmingly likely to go on to puberty blockers, onto hormones, where we start getting super like irreversible stuff. And then like surgery is like, you know, non-contestable, obviously irreversible. So even the stuff that is like reversible, technically, you have to like side-eye all of that as well. You have to consider that you're loading the dice and that someone's more likely to then go on to the next thing and the next thing.
Very necessary medical interventions like surgeries for knees or gastrointestinal or any of these other things seems like a much higher degree of evidence specifically for things that don't cause long-term damage. Now, if you're specifically talking about the bottom surgery or like the idea that they are like these hormones, like all of these things, while they might have things that don't ever go away, the idea that they are like these permanent life-altering things
that don't ever go away. So there are these things that don't go away, but it's not life-altering. I think plenty of people would find growing facial hair, losing their head hair maybe, having their voice forever deepened. They might find that life-altering, depending. A man growing tits, you know, either side potentially being sterilized by the HRT alone before we even get to like taking the genitalia off. I think that's pretty big, no?
That require like this super extra scrutiny where we still allow lots of other like very necessary medical interventions.
I don't know. So far, this guy seems like he's been told a lot of stuff and is just running with it. You get these kind of ally types. I think he probably means well. I don't think he's like a bad person or anything. I think he's probably been listening to a lot of people that have been telling him certain things and not telling him other things. And sometimes it becomes a case of, well, you have to see all of the evidence. You can't just see some of it. I would say some gender critical types probably fall into the opposite camp, where all they ever see is the negatives. Well, I don't think you can conclude that it's like solely a negative thing. But even in the face of like taking hormones is forever altering parts of you in a way that can be life-changing. Like you just got to accept that, man. You got to accept that. There's no way around it. People will say, oh, if you had a mastectomy, just get a boob job, or oh, well, you can always just get a mastectomy if you grow tits and then change your mind about transition. Those are like big things. And like unnecessary surgeries are things you'd rather avoid, no? There's a lot of money being spent on any one surgery. A lot of risk. You know, any surgery is a risk to your health in some way or another. So if you're getting ones that are that should have been unnecessary, that are only necessary because of other things that you've gone through, like, I don't know. He's been gaslighted. It does come across a bit that way. Hi, multi-chat. I hope you're good.
Like surgeries for knees or gastrointestinal or any of these other things seems like a much higher degree of evidence specifically for things that don't cause long-term damage. Now, if you're specifically talking about the bottom surgery or like I like most of these. Well, then if it lags out, I guess. But my question is, it doesn't seem to be the case that any of this or most of this stuff, a very small fraction of it, is this permanent, completely irreversible thing.
Jesus Christ. You just don't know.
And I think what everyone thinks of when they think of that is mastectomies and bottom.
I can tell you for nothing, taking HRT has like changed like how I look a fair amount. I have breasts. I didn't have those before. It would have like sterilized me if I didn't end up getting surgery anyway, making that whole thing moot. Like if you take testosterone, necessarily after a while, your parts are going to start atrophying. You pretty much have to get like a hysterectomy and other stuff. There's like serious like side effects that this person is like seemingly pretending doesn't exist. And in a way, I think it's easy to get that impression. Because I don't know about anyone else. I feel basically no different. Or I certainly felt no different, like taking estrogen. Just certain things changed, certain things happened.
Bottom surgeries versus testosterone, estrogen, puberty blockers, any of the other things that would fall into things that are not going to cause long-term, permanent, irreversible changes to your body.
That is just so untrue that it's unbelievable. Like, you're there with a fucking trans man, bro. Look at this beard on this guy. Yeah, I'd say that's pretty, like, fucking irreversible. Be a fucking hell of a lot of, like, electrolysis therapy to get rid of that. Very painful, very time-consuming. I just can't believe what I'm hearing. This is, like, ignorance at its worst.
Bodies, or if they
It's well-meaning ignorance. That's the problem. That's the last thing you want to be, is, like, well-meaning but ignorant.
are very minor things, like potentially secondary sex characteristic enlargement, or like bigger clits, I know is a thing that happens, but it's not like this, oh, your life is over now because you made a mistake.
Like, how would you know you're not trans? This shit changes for lots of people. Oh my God, it's painful, painful, it's painful. I hate allies. I hate allies. Just don't be an ally. All of you allies, stop. Be friends with some trans people and just be there for them. Stop this ally shit. You're not helping anyone.
If you're advocating for more...
Why are there trans people on this panel defending fucking gender-affirming care? Why is it a man and a woman who haven't been through any of this? And one of them is now saying, well, I don't think hormones really does any irreversible stuff. Bro.
Checks and balances for people who are going to get the most irreversible thing, I would agree. And the CAST report says that, as well as the Endocrine Society and WPATH. But if you're saying these things...
Yeah, your clit looks like a micropenis, but it's not a big deal. Isn't that down to any one woman that has taken whatever and now they have a clit that looks like a micropenis? Like, I don't know about this, bro. Like, I feel like the guy above him, this must be kind of irritating to listen to. Like, you can see, just looking at this guy above him, Aaron, the trans man, does this look like perfectly reversible, like non-life changing, like effects of testosterone? Does this look like that to you? Oh my God. I'm surprised this guy isn't blowing a gasket listening to this.
Things are mostly irreversible. I guess I'm asking you to elaborate. Like, what do you mean by that?
Oh, Aaron, I don't know if you want to jump in. So even I do feel like you're downplaying to a certain extent some of these things. So you're
down, yeah, just a little bit. Fuck me. I think that's downplaying. I think what he's saying is nuts.
right. Not every intervention, even medical intervention, is going to be irreversible. There also are sex differences here that are notable, right? So a male who's taking estrogen and changes his mind and decides that he wants to detransition is going to have an easier time passing as his natal sex than a female who's been on testosterone for the same amount of time. And we can say, oh yeah, like your clit might grow, but this can cause like extreme discomfort, sometimes not fitting in people's underwear.
Yeah, leave it to a man to say, oh, well, your clit might grow and become a micropenis, but it's no big deal. Leave it to a man to say that, yeah.
Wear anymore, rubbing up against their, I mean, it's like silly,
It's
but
easier to find.
It's easier to find, but these are not such simple things like, oh, it's only secondary sex characteristics.
I hate people that do this. You're either having a serious conversation or you're having a joke conversation. Pick one, please. It makes it seem like you don't actually take any of this shit seriously and you're just saying what makes you look like a good person. Please do not do this. Bad enough with the hat and stuff. I guess that's his thing. That's his streamer get up. That's fine. But like, come on, bro. Come on. You just said some of the most retarded shit I've ever heard in my life about HRT. And now you back it up with a joke. Just don't. Just don't. If you don't take this shit seriously, why are you here?
Well, that's a big deal, especially for someone who's experienced dysphoria before, who is having all of the severe distress around their secondary sex.
Yeah, like, you get women that'll start taking tea and then get dysphoria for real because it's like, oh shit, this is what dysphoria is actually like because I'm not actually a man after all, it turns out. Oh my God. Yeah, I'm sure those kinds of people are going to feel great about the male pattern baldness and the deep voice and the micropenis, you know?
Sex characteristics. We're in some cases, in people who regret it, who detransition, we're inducing dysphoria.
Maybe he knows what it's like to live with a micropenis. Have you ever thought about that? I guess I didn't consider that, no.
Essentially for them, after the detransition point. And yes, I do want higher level of consideration for people who are going for those most invasive types of procedures. But actually, I even think the sort of gatekeeping solution that a lot of trans people themselves and kind of moderates in this space point towards is extremely flawed. And so I ultimately take actually more of like a radical trans activist, like the Andrea Long Chu approach, which is essentially anyone should be able to get it for basically any reason under the category of self-determination and body modification. And so I do think in order to get to
I guess I would agree. I mean, what stringent shit do you have to go through in order to get like a tattoo or something like that, to get breast implants, stuff like that? I guess I can buy that, but then that means taking it all off the insurance, taking that all off the NHS. It's kind of you either have to medicalize it as being like a mental health issue, which I think is appropriate in some cases. I think gender dysphoria can very much constitute a mental health issue. I think anything that becomes that pathological in your head constitutes like a mental health issue. That's a tough one. Should there be two different streams? Well, you might be able to get it for free on the NHS if you have dysphoria, which anyone can just say they have and say the right things anyway. Or do you just treat it as a body modification, meaning it's presumably something you're going to have to pay for either way?
To that, I think Aaron and I have similar end states where we would want sort of open informed consent, maybe different ideas of how we get there, but informed consent would mean notifying people about what the common causes and pathways to gender dysphoria are, giving people information about what they can realistically expect from these types of interventions.
I mean, this was how the NHS did it, like, presumably still does. This was like basically my experience.
And not associating legal accommodations with these things either, because all of these are things that can incentivize people in the wrong way, potentially to their detriment. So I think about people who are trying to make pragmatic compromises on things like trans women in sports and in bathrooms and stuff like that. And people will say like, oh, well, you know, we can just make the standard that trans women who have had bottom surgery, you know, should be allowed in restrooms. And it's like, well, that might influence more trans women to have bottom surgery who wouldn't necessarily want that or need that. And that's a whole complicated thing just for them to be accepted as a trans woman. And so I don't think that we should be, I think that there's dangers of going the strict gatekeeping route as well.
Can I want to get Aaron in here a little bit. And I want to ask a question to Aaron and to Tali. So
Yeah, maybe the trans person on this trans panel should actually talk. That'd be great. Agree.
right? Because we talk about a lot of the wide variety of medical interventions and how it's being handled in America, right? So I'm not talking...
Listen, I don't normally like doing that. I'm very, very acutely aware that plenty of trans people have absolutely dog shit stances on like trans shit. At the same time, we've got two very ignorant people. I think Tali is basically fine so far. I don't know. I need to think more about like the body modification point and stuff like that. But like, fuck me. This is rough so far. This is rough.
About Europe or Britain or anything like that, but in America, in the West, right? How is our system handling trans healthcare? In what ways do you find it failing? In what ways do you find it harmful? What are your like...
But you got to understand. To me, erudite seems like yet another of those people that's angling to sort of try and become like the Joe Rogan of the left or something. She's talking on some recent thing about going to some Dem convention after they lost the election and saying retard a bunch and being edgy and stuff and, you know, wanting to prop up people like Destiny despite how unpopular he is for a lot of his conduct and stuff like that. And what they've come with so far is like, well, I think it might be neurobiological based on nothing at all. And well, the evidence is shit, but the evidence is shit for other things too. Like, this isn't great. This isn't a good start. Your biggest criticisms of the current way that the medical field and society handles trans healthcare. And I want to go Aaron first, hear his opinion, and I want to get, open up discussion like that. Go ahead, please.
Awesome. Yeah. I'm really glad you asked that because like bringing up the Cass review it doesn't really make a lot of sense in the U.S. context because as Tali already alluded to, we don't actually keep the data. We don't do the research into actually these treatments that are being provided. There aren't assessments like people think that there are assessments. The providers, like one of the major trans healthcare providers in the U.S. is Planned Parenthood, and all you have to do as an 18-year-old girl is show up and say, I'm a trans man, I want a testosterone prescription, and they say, great, you want to start at 25 milligrams, 50 milligrams, what?
Yeah, what he's hitting on. You'll often hear these things where some people are saying, oh, I had to wait like forever to get literally anything. And other people talking about how they've gotten fast-tracked. Well, it's like quite decentralized in America, isn't it? They don't have the NHS or something like that. So of course it's going to be like that. Of course people are going to have different experiences. And what people too often seem to do is pretend that one or the other of those experiences don't exist. Oh, these people must be lying because they're saying something like, oh, well, I was rushed through. Well, no one's rushed through because I had to wait ages. Well, both things can be true, especially when your medical system is like as decentralized as this.
And then when you need to go get your, if you decide to go get a top surgery, you can, I'm not exactly sure actually what the requirements are currently, but for a while it was you needed two referrals from a mental health care professional. These mental health care professionals do not know what they're diagnosing either. They don't know what they're treating. They just know that the only solution for gender dysphoria is to give you what you want. And so they write this letter saying, I think that so and so is qualified, or I recommend, like it, or it's whatever it's a canned statement that is essentially saying I'm recommending this top surgery for this person that I've sat with for 15 minutes and I don't actually know from Adam, but because they have no other alternative. There's no alternative treatment, and it's just this is what you do when someone says they're trans. You give them the transition treatment. And if in Oregon, I think it's like 15 years old, you can make this decision for yourself without any any guardrails. It's completely Wild West. And Erudite was referring to that there's like these neurobiological correlates. If that were true, then we could test for it. We could actually determine who is trans and who isn't. But
Well, if you identified what the neurobiological cause of this is, then yeah, surely you could. Earlier, she said something like, maybe there could be some kind of gene that is like activated or something. Well, then yeah, you're talking about something that could be observable if it were to be found, right? We haven't found anything yet. So any of what she's saying about like neurobiological causes of like trans is speculation. And it's weird how we're like, I keep saying this. I'm so fucking sick, by the way. Whenever I talk about this shit, there's always someone that's like, oh, well, no one's actually making that argument. The trans brain shit is coming back round because we've realized there are no other fucking arguments for it that make any sense or don't just make it sound like a fashion thing, which maybe it is. I don't fucking know. I don't care particularly. Like, it's just not enough. We don't have any of the information to say, oh, this must be something that happens in the brain. As in like neurobiological, as in like there's something in some people's brains that is causing this. They don't scan your brain. WPATH doesn't say shit about your brain in that way. They don't recommend any of that kind of stuff. So we just don't know. It's speculation, ultimately.
Not true for any mental health.
Like people are saying this is real, so it has to be based on something that is real. Well, that doesn't necessarily work,
Health condition, right? If you could medically just test for depression, we'd have it. But there are neural correlates associated with depression. We understand that depression's real and that you can find it and that it's a thing that we're testing for, but there isn't like a part of the brain, there isn't like a bundle of nuclei that I can point to and be like, there it is, like, there's the depression, I found it. But that doesn't exist. In fact, we don't even have good biomarkers for things like ADHD, which is an extremely genetic disorder, right? Or schizophrenia. We really just don't have these things, even though, like, for example, there's evidence, for example, that the putamen in at least male to female transgender people, the putamen is a part of your brain within the limbic system, and it is enlarged in women, and in transgender women, it is also enlarged to be closer to the volume size of women versus men, right?
Well, it was actually measuring sexuality, that study.
Or rather, it's a proxy. It's a proxy.
Hold on, one at a time.
Sorry, it's a proxy. So what they're identifying as trans women's brains is what they're seeing in effeminate homosexual brains, essentially. And so it's a proxy for homosexuality. The neural correlates that we have are for homosexuality, not specifically for being a trans woman. So, for example, those neural correlates do not hold if the trans woman is attracted to women, which makes up something like 89% of the self-report of like the largest study.
I don't know if all of the studies say this, but there's certainly issues in this regard. And it's like, well, if you're effeminate, what kind of activities are you getting into? Are you more likely to hang out with women than men? More likely to pick up certain like ways of socializing? And then if you consider neuroplasticity, it becomes, is it a chicken or the egg thing? So all we can do is speculate on this. And it might end up being a dead end. It might be a waste of time. Like me personally, I wouldn't want to spend this much time focusing on like trans brains arguments because I just don't think there's much to it. And most people don't think there's much to it. And TRA fucking activist types, they don't want it. Because it would be a thing that you'd suggest, oh, well, we can find it, therefore we can establish who is trans and who isn't by your brain. They don't want that shit. They want to be open for anyone to do for any reason. Because it's about identity. Well, I don't know. Ultimately, identity is another weak one because anyone can call themselves anything.
Of transgender adults that we have. And I don't use that as a boogeyman. I'm very pro-transbian. All my followers on Twitter are basically that. But
this isn't the only, like,
neural correlates are literally for homosexuality. They don't go for the overwhelming majority of trans people.
They're just not as well, though. And the issue is that the neural correlates that might like precede sex. I've looked at the studies as well, right?
Oh my God, they're going to fight. Please fight.
When you look at changes in like the INH,
did it control for sexual orientation?
Let Erudite go for a minute, please. Go ahead.
Yes,
because I think some of them do, not many of them. And the other problem is when they control for like sexuality, the sample size is usually tiny to begin with. So then we're cutting them in half to have different like subgroups where it's like maybe about 12 people in each. We're like really rapidly ramping down like the generalizability of like any of these studies. Like I've looked at a bunch of them myself.
So I was looking at specifically, it was, I don't know, I'll have to go through all of the specific studies. I don't have, like, I'm looking at like 9 etiological studies right now. So in another study, there was a reversal of the INAH3 in the subnucleus of the hypothalamus, right? That we see in transgender people. Now, again, this could or could not be
homosexual
right?
trans people. It is. If you look it up, I understand what you're saying. And if you look it up, that is what you're going to find. So we do have neural correlates. And by the way, homosexuality is an etiology. It's a known pathway to gender dysphoria and to trans identification. So it's not surprising that we would see these neural correlates, but they don't actually hold when you control for sexual orientation.
But again, that might not even exclude anything, and I'm not going to fully grant to you. I'll look for it.
It excludes something like 89%.
You gotta let me finish my speech. You gotta let me finish what I'm saying. The issue is that if we have a consistent potential theory, we know that sexual dimorphism begins around the 3rd week of development, and we know that there are some key areas that are being developed within the limbic system, and there are some sexual dimorphism that we expect to emerge. There is reasonable to believe that it's possible that this is where transgenderism might be burgeoning from, and it is quite likely.
A masculine man participated in feminine activities for a certain period of time where their brain looked different. Well, maybe, yeah. That's the whole thing about like neuroplasticity. A lot of things like shape your brain in all different kinds of ways. So it's such a difficult argument. Like, I don't think any consensus is going to be found here, but then how can it? When so much of the studies are so speculative and like the barrier to entry is, do you identify as trans? Well, what if any of those people who identified as trans at the time and showed a somewhat feminized, shall we say, brain, or if any of those people go back on their identity one day and change their minds, well, then you've got an effeminate male with a slightly feminized looking brain. Therefore, what does the gender identity actually have to do with anything?
That the pathways in parts of our brain that are important for sexuality might be similarly aligned next to gender, in the same way that it seems like autism is somewhere within these correlates as well. But nobody would say that because autism and transgenderism might share similar neural correlates, that now both of them aren't true, right? Because if that were
like with autism, I think it's more like, I think it's more social, honestly. I think it's more about the way that we like, when you're autistic, it's like, there's a lot of like unwritten rules that might just seem stupid to you, that you don't really understand why it's like this, and it's annoying. I think gender roles are like very much one of those things. And I know that because I felt that hard. There's a lot of stuff that I felt expected of me, whether rightly or wrongly, as a male or as a man. Where it's like, I can't conform to this. And I think it's stupid that it's like this. You know, I think it's probably more of a social thing when it comes to autism being like highly correlated with trans. It's more about the way that you think and the way that you interact with society. But all that social constructed shit has to be there first. If we wiped off all of that, I don't know what correlation autism and trans would have, ultimately.
true, then OCD wouldn't exist either, and neither would addiction.
Well, but that's not what we're saying.
And OCD, well, it is what you're saying, right? You're being like, well,
no, I'm not saying that autism. I think autism, gender, and sexuality, I think those things are.
Yeah, I don't know if that's what she was saying, but okay.
Closely linked, so it doesn't surprise me at all that we see similar patterns in neural correlates. So I'm not saying none of these things exist. I'm saying they're not pointing.
Yeah, all these like patterns, neurocorrelates and shit. It's like, well, it's chicken and the egg shit, isn't it? Which came first?
To what we think they're pointing to.
Okay, I know
what
everyone's
I'm saying is that they're suggestive of the things that we're pointing to, right? Because if we were going to reduce neurocorrelates down, then yeah, we don't really know the difference super well between things like addiction and OCD because a lot of them happen in the same areas of the brain. But obviously we think that OCD...
Well, how valid is any of this like trans brain shit then? If we can't really observe almost any of it, then it's just speculation, no? Then it comes off like, well, it's like, this is the best we can come up with because it doesn't seem to really based on anything. It's largely social.
and addiction are different because of their phenomenological presentation. And so this isn't to say, yes, here's transgenderism in the brain. I've never said that that's the case. What I'm saying is there are neurocorrelate pathways that we are seeing consistently, repeating over and over, that yes.
Autism fosters non-binary over trans, my guess. I don't know, maybe nowadays, but I mean, trans has been like a known thing longer than like non-binary. Like, I don't know. Like I said, it's because these things exist. It's because these things have been socially constructed to identify with or not identify with. You know what I mean? I think that gender nonconformity is probably just more common in general with autistic people. And I think a big part of that is that autistic people don't necessarily understand or appreciate a lot of this like unwritten rules kind of shit, you know? Don't always understand social etiquette, come off rude, think that certain things that are away because of culture and seemingly nothing else, they're more likely to think that kind of thing is a bit stupid and a bit arbitrary. Okay, so I'm the man, so I have to be the one pursuing the woman. Like, why? You know what I mean? And no one can really answer in a satisfactory way.
Have comorbidities with other things, but it's important to look at these things and go, this is something that is reasonable.
Well, the other part you say about autistic people being vulnerable to like social pressures and stuff. Like, they also find it harder to, like, socialize. So something's laid out in a way, oh, well, this is how you can make friends by doing this, that, and the other. I think that's potentially where they're more likely to then be vulnerable to that kind of thing. But, you know, I'm spitballing, ultimately. I can speak from my own experience and other people I know. I only know so much myself, bear in mind.
Legitimate. There's no reason to believe that it isn't legitimate.
One of the issues or the I guess the criticisms of trans-affirming healthcare I hear does center around homosexuality. However, can she still hear us? I hope so, because this is kind of addressed at her.
Took her headphones off.
Yeah, she took her headphones off, bro. Probably not likely. Is it very often that someone sits there with like in-ears and then headphones over them?
So possibly not.
Oh no. Okay. But okay. Hopefully she's okay. I'll just say it anyway, and when she gets back, she can't hear us.
No, she's back.
Oh, she's just getting a drink. Okay, she's back. Wonderful. We can. No, it's fine. It's fine. But this was kind of a
just casually holding up the panel for a second time. Nice, classy.
Referring to what you were saying, so I wanted you to be here to hear it. So one of the criticisms.
Title of their podcast, The Navel Gaze, is the most unironically accurate title for this much neurosis over sexuality. Well, I mean, Jesus Christ. That's like the meta now, isn't it? Everyone's neurotic over all this like identity, sexuality shit. It's kind of, you just got to engage on those terms, I guess, now, don't you?
Criticisms I hear about trans-affirming healthcare.
I mean, again, you could say the same about me. Like, if someone's to say, well, you criticize others for being like neurotic about their like gender and stuff like that, but you spend all this time out there talking about this shit. It's like, well, yeah, it's kind of true, you know, but that's how it is. That's how it is now.
Is that it is erasing homosexuality and misidentifying someone who is homosexual as trans. And would that not be important? Or if what Talia is saying is true about how 89% of these people are just homosexual.
Opposite.
The opposite.
That's actually the
Okay,
opposite.
the opposite of what you're saying? Okay, maybe I misheard then.
Yeah, this is the problem with these brain studies, though. How much of what we're pinning on gender identity by centering around that is not actually due to something else. I guess I'll keep saying it till I'm blue in the face. There's every chance any of these studies, the gender identity variable is actually completely meaningless, means nothing to it whatsoever.
But your question is still valid and is I think pertinent and one that we should address. But it is the statistics are the opposite. Okay. And when I'm talking about homosexual and heterosexual, just for clarity, I'm talking based on sex, so not gender identity. So.
Yeah, but I guess what guardrails are currently in place to make sure that we aren't just misidentifying someone who is just homosexual and saying, well, actually, you're trans.
Well, there aren't any guardrails, are there? If you're just going to be able to say, I'm trans. Oh, since I was 3, I wanted to wear my mum's makeup and jewelry. You're probably just going to get transitioned. Like, there aren't many guardrails at all. And it's probably going to be quite hard to put them in place, quite honestly.
Do we know? What are the current guardrails? And I'm asking this to Erudite and to Soy Pill.
I spend time talking about their shit, not your own. That is true. I do talk about my own shit occasionally, but I don't know. It's not that interesting, to be honest.
What are the current guardrails in the system, if any?
I don't know.
I don't have WPATH memorized personally. I'm not quite sure. I suspect that there are guardrails for this, right? I imagine that there are going to be questions. For example, typically when kids are doing this, they're taught to say in gender reference clinics, they're typically taught to say that they aren't gay or anything like that, or questioning their sexuality, so that they can move on to gender affirming care, right? And so it sounds like there is some level of checking to try to affirm whether or not this is sexuality. And to be clear, do
you know what the barriers to entry were for me? I had to go see a psychiatrist before I'd get referred to a gender clinic. They more or less straight up asked me whether I have bipolar or schizophrenia, and I said no to both. That was pretty much the screening process. I don't think my sexuality came up once. Oh, thank you, Spencer. No, I more mean like going on about my my own gender shit is probably not that interesting. At least not for long periods of time. It's fun. I watched that Ray Alex Williams thing, and that was really fun, kind of digging into my own experience to kind of find a middle ground between what he was saying and the more trans-affirming kind of stuff. But it's not something I want to do like all the time. I mean, ultimately, I want to criticize like media. That's like my main goal, because people say a lot of shit that is just accepted by a lot of people, even though it's bullshit, you know? Thank you, DJ Mr. Joel.
I would never deny that there's going to be some level of comorbidity. You guys are shaking your head. I'm dubious that WPATH is so negligent in so many ways that they're not in any ways wanting to see off-ramps, because I'm reading through Yale right now.
Well, does that even matter? Does it even matter that WPATH might personally think, well, you should check for this, that, and the other? In a country like America, where it's so, you know, Aaron was saying earlier that with Planned Parenthood, there's very little like gatekeeping at all. Some clinics, you imagine you show up, and if they're money hungry enough, they'll just transition anyone that walks in. You might get some that are more discerning. Surely the gatekeeping, the barriers to entry are going to depend on the clinic, no? Like, I'm not aware that WPATH really has that much to say either. But even if they did, it's kind of like, so what? Dubious that WPATH is negligent. Yeah, Erudite has so much to fucking learn about this subject. It's painful to listen to. Again, this is what I mean. The well-meaning allies is very apparent with this guy with the propeller hat. Is very apparent with Erudite. There's a conclusion taken that we now need to do everything we can to fit the narrative to. But it's not working. WPATH is fucking negligent. Has this person read the WPATH files? Have they listened to Brianna Wu and Marcy Bowers talking? Now, don't get me wrong. Brianna Wu made a fucking twat out of herself this conversation. But Marcy Bowers came up with some interesting stuff about how a lot of the research for adult care was kind of, they used the Delphi approach or whatever, kind of applying that knowledge to kids. And that was a lot of what they based their shit on. Stuff like that. There's that clip of Marcy Bowers talking about how, you know, these kids that they transition, boys, 9 to 11, Tanner stage 2, they were having no ability to orgasm after everything. Clearly there's issues, you know? And she just doesn't know. Just assume, oh, it's a major medical organization. They must have their shit together. That's why I harp on about this point about, well, every major medical organization says this, that, or the other. Most of those fucking organizations are either pointing to each other or pointing to WPATH. And there's some interesting info out there about WPATH. But these people don't know. They don't look. They dismiss any of this shit as like turf shit. Well, I'm sorry. There's truth to it.
Now, do you have any evidence of WPATH being so negligent that they like actively want to just see kids getting harmed?
They don't want.
WPATH files. Go look it up. You're not hearing me. You never will. Oh, well.
They don't want to do.
Hold on. Aaron is saying yes. I want to hear what Aaron has to say real quick. Aaron, you're saying yes?
I don't think they want to see kids harmed, but I was literally at the WPATH conference in 2023 when they were unveiling the Standards of Care 8, and I asked them how they can determine, or how is there any way to determine the difference between a kid who's going to grow up to be cis and a kid who's going to grow up to be trans, and I was kicked out of the conference for asking it.
Oh my God. That's fucking nuts.
how they can determine, when they were unveiling the standards of care 8. And I asked them how they can determine, or how is there any way to determine the difference between a kid who's going to grow up to be cis and a kid who's going to grow up to be trans. And I was kicked out of the conference for asking it.
That's like not negligence. That's like censorship. That's crazy. That's a huge fucking bone of contention when it comes to transitioning kids. How do you know which ones are actually going to persist and which ones are likely not to? Because you're necessarily fucking with their bodies a hell of a lot for something that might not be right for them. And there's no way of screening it. And this is such an obvious thing that people just don't think about. There's so much wrong with WPATH. It seems kind of corrupt. They seem to be fine with transitioning people with like multiple identities, which to me by itself is insane. Someone's got multiple different gender identities inside multiple different identities inside one head. Why would you nail it down to any one of them? Like, Jesus Christ. These people just don't know. You just trust institutions. Where'd you get that from? Oh shit, destiny. Oh, we need people to trust institutions more. Well, that depends on those institutions being trustworthy, you know?
They have no answer. I was just repeatedly called transphobic for even asking.
Yeah, so here's one of the problems. And
yeah, the trans man got called transphobic for asking a very basic question. It's insane. It's nuts.
This is, I think, something that everyone here can relate to. We're living in such a polarized political environment. And so everyone kind of bunkers down on their sides. And so I don't think that there's some conspiracy, again, to withhold the truth or to hurt anybody here. I think that, and what we've seen actually come out in recent years. And
well, there has been conspiracies to withhold the truth. There was that Joanna Olson Kennedy study that she sat on out of fear of it being politicized. And then it finally comes out now. Well, it's showing that there's almost no benefit to transitioning kids. They don't actually seem to be any better off. Like, I guess the counter argument would be, well, maybe that'll come later when they resemble their chosen gender more. But then there's the other thing where it's like, well, we're seeing evidence now that post-op trans people are more likely to experience things like depression, like anxiety, that regret tends to set in years and years later. I don't think Destiny talks about trans people much. No, what he was talking about, like, I've heard him many times. I used to be a big Destiny fan. Talking about like wanting people to have more trust in institutions. That seems to be what Erudite is saying here. And like wanting to just implicitly trust, oh, it's WPATH, they must know what they're doing. It's dangerous. You can't do that. Certainly not anymore.
And as recently as like a couple of days ago, is there are researchers and people high up in WPATH who are nervous about any crack being used against them and being used against trans people and barring trans people from getting access to care. So they are afraid that if we show that some of the evidence here was lacking or some of the gatekeeping mechanisms here are lacking, that the Republicans are going to come and take their healthcare away. And by the way, that seems to be founded in some reality, right? So there's understandable reasons for them doing this, but that is...
Yeah, it's founded in some reality, but consider maybe it would have been less of a problem if they were more open and honest and just kind of showed it for what it was. Maybe part of the reason that you might be seeing like bans in the future, who knows, is because of all the lying, because of all the duplicitous kind of shit, you know?
Is what happened. And so just to address the sexuality component specifically, you are partially correct that historically, especially, trans people would go into the health center and they were actually told to say they were gay based on their birth sex, right? That they were attracted to the same sex so that when they transitioned, they would be a straight couple, right? Because it was the purpose of this intervention was to only select the trans people who they believed could normalize into society. They didn't want to be creating more gay people. So a trans woman attracted to women would go in and lie and say, I'm attracted to men. And that would help her go through and get the treatment that she wanted, deserved, was entitled to, whatever. We don't have this problem anymore. You cannot reject someone for medical intervention, trans medical intervention based on their sexual orientation. So I don't think we have high occurrences of people lying about their sexual orientation. One thing that we have is a huge conflation because providers are not assessing, they're not at least defining their terms. So they're not even assessing whether the person in their office is answering their sexual orientation based on gender identity or based on their sex. And so a lot of...
Yeah, that'd be a problem.
Especially the younger cohort, they're going in and calling themselves gay. You'll have young females going in and calling themselves gay. What they mean by that is they are attracted to men. They are heterosexuals who see themselves as gay trans men. But those questions are not even being are not being asked. So we have
Can I ask, Holly, because
almost
this has
no.
been going on for a while, and I've been wondering this since the beginning, which is, like, I do not know the WPATH specific requirements when they ask these questions. However, when this idea that this is conflating some sort of homosexuality into transness, if they're looking for and trying to identify people with gender dysphoria, how much of this dysphoria is attributed to the idea that they are attracted to a certain sex? And like, how is that at all going to play into the diagnosis other than, well, I think I'm straight or I think I'm gay, therefore I must.
The trans community really neglects the fact that plastic surgery is fallible, let alone all the gender issues. I have had 2 breast augments. I'm a woman, and one was to correct the other. Yeah, that's definitely something to consider as well. Hi, Meegs, I hope you're good.
Must be trans.
But there's very much this thing, like, anything negative is now being weaponized as a, well, you shouldn't talk about that because it'll potentially harm trans healthcare in the future. It goes down to the level of any time that someone detransitions, all these people rush along. Oh, well, it's fine to detransition, but don't say anything, otherwise you'll potentially ruin trans healthcare for the rest of us. And it's toxic and it's disgusting, in my opinion. How many trans folk are on this panel? One, that would be top right, whose name is Aaron. He is a trans man.
At all going to play into the diagnosis other than, well, I think I'm straight or I think I'm gay, therefore I must be trans, because one of these things is mismatched, and not, hey, my body actually genuinely feels wrong. I feel genuine mental distress looking at the secondary sexual characteristics that don't match what's in my brain, which seems to be much more of the indicators that I have heard that is tested for, not who you're attracted to.
So,
well, like nowadays, yeah, but like, I think sexuality is important and plays a factor. And it's completely garbled because people will say they're a homosexual when they're a male attracted to women because they're trans, you know?
well, interestingly enough, I think it's kind of funny because Aaron and I push back. We don't have many fans in the gender critical space either, which is, whatever. But Aaron and I push back vociferously on this claim, like, stop transing gay kids, stop transing the gay away. We don't think that is happening in the overwhelming majority of cases. The overwhelming majority of cases, I have no concern that these are true gay boys and gay girls who are going down a path that is not right for them. There is let's say 10% of the trans population who is homosexual. I don't think that's a reason for them not to transition. Again, homosexuality has been seen as one etiology, one pathway for gender dysphoria for at least the last, well, honestly, like the last 100 years, right? Because they saw it as sort of like sexual inversion, but even seriously within the last 30 and 40 years. So it's always been acknowledged that for whatever reason, homosexuality can be a predisposition for developing this severe gender dysphoria and sex distress. And I think that the sex distress and gender dysphoria is good enough reason for someone to transition. I don't think someone should be barred from transitioning because they're homosexual or because they're heterosexual. So, however,
go ahead, please.
I was just going to say, it's interesting that the groups that Kyla delineated a bit in the beginning, I think actually the group that we need to have the most...
Here in Erudite's chat, yeah, it's been kind of rough so far. It's kind of well-meaning ally kind of shit from both of these people. Hope you're good, Paggy.
Concern about, ironically, is the group who from the time they were 2 or 3 are projecting this gender incongruence, because that group is actually the most likely to desist. So ironically, the group who has this sort of onset of severe gender dysphoria, not necessarily rapid, but let's say adolescent onset of gender dysphoria, is slow progression, not influenced by their friends. They grow up in a religious commune or something like this, right? That tends to be persistent across their lifetime. So it's actually the very young, sort of effeminate or super tomboy kids who the desistance literature tells us are more likely to be the ones to grow up and desist and to come to terms with their birth sex and identify as a homosexual when they are an adult.
Much of that is because the literature that would be looking, so for example, most of the literature that looks at desistance is older literature, because the reality is that the clinical options for desistance aren't offered anymore, right? There isn't really a pushback on gender anymore. But one of my issues with the literature as well is that you're looking at a group of kids that are probably the most severe potentially in their gender dysphoria because they're presenting so early. And so the data showing that they desist the most is there's a lot of issues with the desistance data that I won't even necessarily get into here, that we're citing from about the 70s to 90s. But on top of that, this group is being viewed as the most likely to desist because that's...
I wonder what she thinks of the detransition data now. It's not good. The actual detransition rate is almost certainly higher than any of these studies say. And there's kind of a reason for that. Like, they can't really measure people that just dip out partway through in these studies, so they don't. But then what people do is they take the cited result anyway, that is incomplete, because it's always going to be, and just harp on it as if that's the true rate of detransition, which is just nonsense.
That's probably the only group that even got studied in the 70s, 80s, and 90s, because if you're 12 and 15 and starting to feel this, you're probably massively shunted away and probably not often included. I don't think people were even thinking of these people by the time they're 15. They just thought they were a weird 15-year-old who then becomes a weird adult, and nobody cares that much about weird adults, right? That's my suspicion. And so even saying that like the 2 to 3 are the most likely to desist, I'm extremely skeptical of, because all the early data on this population is oftentimes biased in the pressure to not see this population exist and emerge. And there is a high level of conversion type therapy, which does not have good outcomes for gay kids or for trans kids. Even though they might desist, the quality of life that they lead afterward is not typically very high, right? And same with gay kids who desist being gay from conversion therapy as well. And so one of the issues is that like, one of the issues that we're all going to be running into here is going to be the paucity of literature on this population, right? For example, the things that you're pointing out of the studies that show the neurocorrelate differentiation. You're right. Most of the studies that look back, they don't have the control for homosexuality. The issue is that that doesn't mean that the evidence of the neurocorrelates now doesn't exist. It means that you need further studies with further levels of grouping done, which good luck doing. We can barely get research for just longitudinal studies on these things because everyone doesn't want to do it. But on top of that, just because there is transness and homosexuality being comorbid, it doesn't mean that both of these constructs aren't real, which is why I agree this data has to separate them, but that also isn't evidence, because I think a lot of people would take away from your statements that if it's not controlling for homosexuality, then the neurocorrelates that we're finding is just gay kids. And it's like, that's probably not true.
Oh, we're back on brains again. I don't know, man.
Real, which is why I agree this data has to separate them, but that also isn't evidence, because I think a lot of people would take away from your statements that if it's not controlling for homosexuality, then the neurocorrelates that we're finding is just gay kids. And it's like, that's probably not true.
Well, there's just not enough evidence that gender identity is a factor here. I don't know why we're like, trans brains, is this really the best you can do? Trans brains. I'm telling you, it's come back. It's a mainstream talking point now for people that want to affirm trans people. And the application of it is to say that, well, trans is innate, therefore. And it's like, I don't know, you try and tell people that this is a problem because none of this really says anything. And it's like, oh, well, that's not the argument. They just look similar. So I think a lot of the people that adhere to this like trans brain stuff, they don't even apply it in any way. They just see that there's a similarity. Oh, well, that means trans people are in some way like female then. Trans women. Like, it's just so stupid. It's so stupid. Like, is that the best we can do? We've got trans brains now. I could watch that fucking Mike Brigandy guy and get the same shit. Why do we need erudite to push this shit, you know?
Well, but again, I want to
can see why Destiny likes not so erudite. Can keep her jaw flapping and not take a breath. Yeah, Jesus. I mean, she's taken a lot of Destiny's mannerisms on. I bet if I were to watch like really old content by this person, I bet she talks kind of different. In fact, I'm sure from what I remember, whenever I tried watching her content, which wasn't really for me at any point, I'm sure she used to talk a bit more softly and a bit more slowly. And now I hear that kind of hard-edged kind of speaking pattern that Destiny has. It's interesting.
reiterate, gay people can be trans too. You know, hashtag free the gays. So I don't think that
that's not really a response to what I'm saying, right? I've never even implied that gay kids can't also be trans. What we're talking about is the separation of kids who think they are trans and they end up just being gay. And it's really important to understand that these neurocorrelates can overlap, and both of these groups can be true, and that third group can be true.
Well, we've got no actual evidence that gender identity is one of the factors.
That's what I'm trying to argue.
Sure, yeah, and I'm not disputing.
All of this is speculation. Remember, we don't have any hard evidence for any of this shit. It's speculating based on what people are saying they're trans.
Any of that. What I'm saying is, especially when we're talking about youth intervention, and again, my understanding, Kyla, is that you have reservations about youth intervention, and so my concern is this is the group who's going to be having the earliest intervention because they have the earliest onset. When this is really the only group, like you point out, that we really have any information about desist.
As a blowjob. Oh, okay, fair enough. Listen, I don't know if they ever did anything. I wouldn't be surprised.
On, and it shows that. Let's even use the lowest estimate, right? Something like maybe 50 to 60% of them might grow up and be able to assimilate into their sex.
Can you guys
I think we need to be very...
Yeah, just can you guys answer a question for me that I have real quick? You keep mentioning youth care, right? And especially with these interventions on this cohort of people who are 2 to 3 when they express these signs of dysphoria. What commonly happens? Walk me through the steps. 2 or 3 year old, someone starts talking about how they may have dysphoria. This gets brought up and brought toward the attention of a medical professional. What is the path that is currently what happens to them?
Yeah, correct me if I'm wrong, especially Aaron, if you're trans. You probably know better than me. But my understanding is that up until like even pre-pubescent children, it's almost all social transition. So that might be trying to express your gender a different way. Maybe.
Yeah, of course it is. Until puberty, there's no point taking puberty blockers because what you're blocking. But yeah, it's all social transition. Socially transitioning a kid makes them far, far more likely to then go on to further steps. So you've got to think it as loading a dice, not, well, this is something harmless and reversible and so on. Why do they need to socially transition and not just explore what they want and do what they want and not have it labeled? You know what I mean?
Maybe going by a different name, pronouns, but almost no medical.
Like, why is any of that necessary?
Or physical like interactions are happening at that point. And then once you get to prepubescent, that's when they start recommending potentially puberty blockers, then or hormones. And then past, through puberty and past puberty is when maybe they'll suggest mastectomies, maybe some surgeries if that is recommended. But it's a whole spectrum. And that's why at the beginning we tried to talk about this umbrella of gender affirming care. Not everyone needs a surgery or thinks they need a surgery. Not everyone, even some people like only want to be socially transitioned and they just shave their arms and like grow their hair out. And so, it's not this.
Are they even trans or just a male or female person that is gender non-conforming? If we're conflating those kinds of people with people that medically transition, then the through line is just calling yourself the other thing, ultimately.
It's like all encompassing, like yes or no. It is when and where and to what degree do they need what they need.
Yeah, I would agree with that.
It didn't really say anything much.
Okay.
I don't think socially transitioning kids is the right answer, but that's me.
Well, what does anyone have a problem with that? If we are not okay, as some people have expressed,
it's like you gotta see of it as like feeding confirmation bias and also feeding something else where your kid goes back to school and now they're called something else and now they're expected to be called she, her, and not he, him. What if they change their mind in a couple of years? Might they feel embarrassed going back on themselves like that? Like, especially as a teenager. People put a lot of pride in this kind of stuff. Like, I don't know. Plenty of kids feel embarrassed going back to school after having a haircut because people are going to notice it and stuff. People are going to say things. I don't think it's a good idea myself.
Reservations with youth trans care. What's wrong with that, with what you just expressed?
The social transition is actually pretty monumental when you're talking about a child's development.
Okay.
It can really kind of cement the opposite sex identity that could have otherwise just sort of been
Yes, true.
Kids have phases.
So to be clear, Aaron, you're against it, is what I'm hearing.
I'm against. Yes, okay. I'm against social transition for children. Yeah.
Okay, yeah. Keep going. I didn't mean to interrupt. I just wanted to clarify.
Oh no, yeah, but yeah, for that reason, because it cements this opposite sex identity that could otherwise have been potentially outgrown, and then it's when they start approaching puberty that that physical dysphoria is going to set in where they could have otherwise avoided it, right? If they didn't have internalized the sense of supposed to be the opposite sex, everyone around them is using opposite sex pronouns, like they have this entire opposite sex understanding of themselves, and then puberty just becomes this really existential threat of where your body is going to change in all these ways that, are completely contradictory to this identity that has been formed around you by adults. And it's just really, I think, not just for their own sense of identity, it's very, I think, destabilizing about just kind of biology, like material reality in general, if boys can be girls and girls can be boys, and there's just I just think on a much greater level than just personal identity, it seems quite dangerous to instill this idea in children. But then once you get into the fact of puberty blockers and really kind of stunting maturation and development, it's just there's a lot of negatives, I think, all around when in
can I ask
more often than not, if we weren't in this current cultural moment, the kids would have outgrown it.
My question for that, Aaron, is I'm sure this has happened to some degree. Obviously, maybe someone who is questioning their gender gets socially affirmed, may be pushed over that line of not deciding, hey, actually, this isn't for me because of this, people around them. That's very possible. But my question is,
just think of how hard it is. Think of how hard it is to walk it back, especially as a kid, right?
Oh, fucking hell. Someone's finally saying it. What was it? Fuck. The only other time I've heard someone acknowledge this, I'm pretty sure it was that Malcolm guy when he reacted to my conversation with Alec Gunter. And actually acknowledge this. I'm so glad someone else is seeing this. Jesus Christ.
like how hard it is to change your mind, and especially if you made a big stink about something, right, and you were really insistent that everyone like adjust to this new thing, and everyone finally does. It's really, really hard.
Sure, but
Yeah, what we're saying is it's feeding confirmation bias. This guy's like, well, I'm sure it probably could happen. Like, I don't know. Like, he doesn't seem to know much about anything.
at that point,
Can I push back on this? Wait, let me just say one thing, Erda. Because yes, obviously, if you have this very adamant thing that you're pushing for super hard, it might be this sort of like shameful thing to go back on it. But you could say the exact same thing for going into being trans, if not more, because so many people reject that entire concept. It's like this entire society, most of society is like.
Well, then why label it? Why fucking... why nail it down like this? Isn't that like the problem in the first place? Then let them just experiment. If they're not ready to come out as trans and socially transition, then just let them experiment. Let them do what they want. Let them, as long as they're not hurting themselves or anyone else.
Pushing against you, and you're trying to push against that and say, no, actually, I am not what is natural. So like this idea of like, yeah, maybe they would otherwise say they regret it, but are lying or.
And the problem is that doesn't answer while you're feeding the confirmation bias from the moment you start socially transitioning them. Everything you're doing is going to make it harder for them to go back on that. When to transition them fully as a child, then never having their own kids, they might change their mind about that anytime. How does it feel to get sterilized before you even had a chance to have kids? You made that decision, let's say you were 8 years old. You get to like 25 or something, and you start thinking, shit, I really wish I could have my own kids. I can't, because I made a decision at the age of 8. How's that going to feel? Jesus Christ.
Or like they don't want to, like, they're doubling down. Like, I don't think that's a good explanation for why there's only like a 0.3 to 3% regret rate from the people that do any of this gender affirming care. It just doesn't.
We have no
0.3 regret rate. Where the fuck is that coming from? Like, that's smaller than the fucking Bustos et al. Thing. And that meta study has lots of problems, by the way. This surgery regret thing. What do they cite? 1% or something like that. But there's so many problems with this study. Where was it? Less than 1%. This is 1% and this one's less than 1%. This is a meta study. It's based on a whole bunch of different studies, some of which date back to the fucking 80s. It's very unstandardized, you know what I mean? I'm pretty sure this sample size is wrong. I think they were actually like 2,000 people off or something. I can't remember, was this one a different one? One of these studies, they cite almost something like this number, something like nearly 8,000 people. And then when you read it, you look at the different studies that make it up. It's like 2,000 short or something like that. I can't remember if it's this or something else. But there's a huge problem. There's a lot of problems with this study. You really cannot use a study like this and say, that's what the regret rate is. It doesn't work that way. It's higher. The other problem is, you get shamed if you come out saying, I went through some of this transition, it wasn't good for me. You get shamed, you get attacked. You can't talk about this, that, or the other. You can't jeopardize trans healthcare for other people. So people are like gonna be biased in that way. Like, it's painful. It's painful to listen to. And then, like, a lot of this regret isn't really measured because often it manifests way after the study ended. What is it? Like, I need a good source for this, but, like, on average, it takes a good 8 years, if not more, for people to start regretting things like gender-affirming surgery.
Just to be clear, we have no information on regret and detransition. So to claim any number...
No.
Yeah, he's like, you cannot... Well, there's not no... Fuck me. There's not no information. Oh, Paul Vogler's here. Hey, Paul, it's interesting that in that Torrin and Max debate, you're talking about, oh, I care about trans people, but like this, that, and the other is bad. But then you come here harassing my shit and just like spamming shit in fucking my chat. Are you even listening to me? Are you listening to anything that anyone is saying?
Yes, like literally none, extremely low quality.
That's not literally none.
Yeah, it's not literally none. What you're basing this on, this solid figure that you've given, is not enough to base that figure on.
That's the best information we have. You can say that it's not good enough. And I would agree.
I think what you should do, Paul, I reacted to your debate. I'm not in a fucking echo chamber, you retard. Watch my react to your debate with Torrin and Max. Go and watch that instead of bothering me here. You don't even listen to a word I say. Otherwise, you'd understand that I actually agree with plenty of what you think.
The best and most up-to-date information we have is from a trans researcher named Kinnan McKinnon, and his research shows something closer to 5 to 15% detransition rates. Nowhere close.
Yeah, I am increasingly getting confirmed, I think, that propeller hat guy here, he's had a bunch of trans people in his ear showing him the right studies, the right things. This is what the regret rate is. This is what the detransition rate is. But plenty of it is bullshit.
Close to 0.3%. And again, he's pro-trans, he's a trans man himself. His interest in detransition is to strengthen trans healthcare. So that is the most up-to-date research that we have. Qualitative.
That's the CAS Review's position as well, to strengthen healthcare. This is another thing I talk about. We try so hard to push down detransitioners and to hide them away. Well, detransitioners should be the ones you're looking at so that you can improve the care to make sure that other people aren't making the same mistake. Surely.
Qualitative and quantitative information about detransition.
And every time you cite this thing about, oh, there's almost no regret, or there's almost no detransitioners, based on extremely dodgy evidence, that's what you're doing. You're pushing those people down. You're giving people reasons to not think about them or care about them. Every one of those should be looked at in some kind of detail to make sure that you can improve the care and that you don't just see this wave of transitioners as it gets more of a thing, you know?
But again, it's going to be lacking because of the decentralized nature of American healthcare system.
He's just a weirdo. Look at his debate with Andrew Wilson. Fair enough. I have seen this soy pill guy in one thing before, and he wasn't terrible, to be fair. I think it was a bit more to do with Israel and Palestine. I can't remember the details too much, but he wasn't so bad in this one. I think it might have been something that Erudite was on, to be honest.
So this is why I say we have no information. The data set that anyone can pull from is extraordinarily limited. So we should be, the number could be 1%, but it could be, it's not, I know it's not 50%, but my point is to say anything below 1% is we're just making it up at that point.
Sure, the issue is that if we're
Paul's still here. Listen, Paul, I'm so sorry that Max from Trans in the Mouth completely ganked you, completely made you look like a fucking fool, completely made you look like a complete moron. I'm so sorry that happened. Go watch my react. You'll see what I mean.
we're talking about if we're talking about interventions and invasive interventions, which, by the way, we do very severe interventions with low to moderate grade quality evidence all the time, that are standard procedures. People just don't think about them because identity isn't tied to them, right? I think part of the reason why people get so upset about the trans stuff specifically is because identity has prescriptions for how people engage with you, right? And so,
yeah, I don't think I'd characterize him here as bad faith. I think it's more the well-meaning ally. I think it's more I've been given a bunch of information from trans people who I broadly support, and I'm taking that as an education rather than scrutinizing it, coming to my own conclusions, you know? I don't know if he streams and stuff. I don't know if he has an audience. I don't know if audience capture has anything to do with it, or has friends, people in his life. He said he's in San Francisco. There'll be a degree of appeasement even if he doesn't know he's doing it. I don't know if bad faith is quite fair, but I guess maybe it depends on the appearance, you know what I mean? Is that a World of Warcraft term? I don't even fucking know. I just heard someone else say it.
it becomes this weird thing where if somebody gets a stent in their heart and they're a stable angina, okay, well, there's low to moderate evidence that that's actually effective for non-acute anginas, but also it doesn't affect anyone's life. Nobody gives a fuck. It has.
Do I pay for? I don't get PIP, you retard. We've done this already. I tell you what, do you know how to use Discord? Join my Discord. You can call in anytime.
No social ramifications whatsoever. What?
Just angina was a funny word. Sorry. Continue.
Yeah, it sounds like vagina.
I was like, you're an angina. I'm not an angina. Okay, sorry.
Yeah. It sounds like vagina for all of you 5-year-olds out there. Okay, yeah, vagina.
Real quick, I do want to clear up. Can I just clear up really quickly? That 0.3% and then where that comes from is from that 2023 study from maybe that is that the Jared Juski? Is that the one you said? And that's not a regret rate. That is 0.3% of people in this group of almost 2,000 people requested a surgery reversal. So there's probably maybe some people.
That's not regret then, is it? Surgery reversal. So his regret rate is based on how many people asked for a reversal. For most people, it's too late. If I regret my surgery, it's too fucking late. But if I didn't ask for a reversal, because what the fuck is there to reverse? They took most of what was my penis and threw it away. I ain't coming back. But I don't regret, according to this guy, based on this metric.
Sorry, that's just anti-trans.
Unless I asked for that. That doesn't make any sense.
Mary makes money how?
Oh, thank you so much, Mr. Clacker, for the £10. Thank you so much. How's this not bad faith? Well, it's hard. I'm willing to accept that, like, he believes in what he's saying. I just don't think it's coming from a good place. I think it's coming from a place of ignorance rather than bad faith. I try and distinguish the two if I can. Maybe I just hear bad faith so often that I really think it needs to mean something specific. I'm not sure.
That like, hey, I don't want to put in the money, or I'm doubling down on this because now my body's like that. That would put a little higher than that. I'll concede that, but I don't think I'm not saying that like it's a 0.3% regret rate, although that is how I decided. But it's an incredibly low amount of people that are like, this is not what I wanted. According to this, not
Right. Of the number of people who are going back to the same doctors even to request these types of revisions or reversals. This is another thing that Lisa Lippman found also in some of her research into detransition, is that a majority of the people that she surveyed did not go back to their healthcare provider to let them know that they had detransitioned or to request additional care, that for various reasons, but the majority of them were not even notifying their healthcare provider.
So this is
there
also
are limitations.
Right.
There are limitations.
Cannot be reversed.
Right. Not to the same degree that they can be done. Right. And so when I am conflating this in the numbers of as well, people self-reported regret as well. Right. So that's like kind of unfortunately.
Even self-reported regret is only so much. It's only going to get you so far. People might regret things that they don't want to voice for all sorts of reasons. Fear of reprisal from the community, for example. Look at how people talk to like detransitioners. All that shit with like fucking Hendrix. What if he's genuinely detransitioning?
The best way, which is not great. It's self-reported, but still seems to be incredibly low. So just to clear that up.
Still seems to be incredibly low. So the evidence I'm using is shite, but it's still incredibly low. How do you square that, bro? How can you make such confident fucking appraisals of how it is when that's what it's based on?
Not to say like, oh, you're super wrong. I agree. This is understudied. This is not the best quality evidence.
And if it's so up in the air, then at the very least, don't you have to concede that maybe this is not right for doing to kids? Wouldn't you want all the evidence to line up? Wouldn't you want it to be pretty much inconceivable that any kid will regret getting transitioned to say that, yeah, maybe kids can transition then? Doesn't it have to be far more airtight than it is? It's not even the fact that, like, I don't know, how do I put this? Fuck me. Like, too often, people will just find any of the studies that agree with them and cite them endlessly and shit on any of the ones that don't. And then the other side will do exactly the same. In a way, that shit doesn't matter. The fact alone that all these different studies are coming to different conclusions. So it's like inconclusive. So it's not great a foundation to be doing this from. And again, like I guess I would say like adults can make those decisions and understand that and go ahead and do what they're doing. But like, why kids, you know? Based on that foundation of evidence, why insist on doing it to kids? I don't think it's right. I don't know how these two can't fucking square that circle, honestly.
And it's very hard to track longitudinally, like these people at the same doctor.
Listen to Jesse Single's call to the Majority Report. I think I've heard it. I saw one where it was just Sam Cedar screaming at him and Jesse Single's mic was so low I couldn't hear a fucking word he was saying. Ironically, Sam Cedar seemingly doing the same thing to Jesse Single that fucking Steven Crowder did to Sam Cedar with that Ethan Klein shit, where Steven Crowder just monologued over him for like 10 minutes, then hung up. Bizarre.
Doctors in the same case studies, like even if they like move around, but like to the best of our knowledge, these rates are still incredibly low. And that's the whole idea of why I brought this up, is this idea that, oh, people are afraid to go back on it because they're like, oh, well, and this is, by the way, including all gender affirming care, not just surgeries that are harder to reverse. This is including social transitions, which is why a lot of this data is a little muddied for detransition rates, because this includes non-binary people who, you know, are like, I'm questioning my gender, or maybe I could go either way. And then if they go back to what they were born as their birth gender, this is called a desist, which is not really a desist, because just because you're questioning your gender and then decide, hey, I actually pick one of the two things.
Hold on.
I think people should just identify as they please and get whatever body mods they want. Well, I mean, I don't know. Depends on the body mod, doesn't it? I think, I don't know, I tend to be kind of towards like freedom to do what you want, but I think it has to have limits. Occasionally, unfortunately, I think people do need kind of protecting from themselves.
is already going to pick.
Hold on. There are a lot of people that I've heard, right, say that non-binary is a form of trans, right? Like I've heard that being said.
No,
right?
exactly. That's what I'm saying is because those people are identified as trans when they're like, hey, I'm not like, say you're born male and you're like, hey, I'm not really sure if I want to identify this way or this feels right to me. And then you're like, actually, no, it is. And they haven't really done any surgery or even any hormones. They were just like, maybe I want to express a little differently in public, maybe a little more androgynous. And now I'm going back to doing what society would call more masculine. That's called desisting, which is very different from someone, going through hormones and stopping. Erudite.
I just want to be clear. Regret rates, I'm assuming there are going to be reasonably high regret rates for people who end up desisting and had major interventions. That would make total sense to me. I'd be shocked if somebody went through a high level of proceduralism and then decided that they weren't trans anymore and didn't regret it because they fucked up their entire life, right? So I would totally grant regret rates. The issue is that even people who get surgeries that are life-saving, there are multiple, I think the regret rate for cancer surgeries, life-saving cancer surgeries, is anywhere from like 17 to 40%.
Why is this comparable to trans surgeries, which are like elective and aren't doing... They're not... I didn't get a vaginoplasty because my penis was harming me anyway. You know what I mean? Certainly wasn't anything like physically wrong with it or anything like that. When you have a cancer surgery, something is like in there growing that's like damaging you. And you might end up with effects after that where it's like, shit, is this actually better than just like dying of the cancer in a certain amount of time? It's just not comparable.
Right? Yeah. So again, I'm not saying that there aren't regret rates, and I'm not saying that those regret rates don't matter. What I'm saying is that we are doing a disservice to trans people by holding the medical practice itself to a standard we are not holding any other practice to. And the reason that I'm submitting...
Is that true? Any other practice?
That we are holding these double standards for trans care versus cancer care versus any other anesthesiology is because fundamentally it's identity based, and we don't like identity stuff because identity has prescriptions and requirements.
Well, the problem is identity is kind of meaningless, and identity changes over time. And the gateway to identifying as something is just calling yourself something.
Of other people. If I now identify as a man, you are required as a decent person to engage with me in certainly socially scripted different ways, right? And so...
She doesn't believe it. Surely not. What?
Don't like identity stuff because identity has prescriptions and requirements of other people. If I...
Well, no, it doesn't. We're acting as if it does, but it doesn't. Identifying as something doesn't mean that anyone else has to do shit. We're just trying to make it that way. And I'm very against that.
I now identify as a man. You are required as a decent person to engage...
This is not true. Just because someone identifies as something, it doesn't make you a decent person or not a decent person as to how you, like, treat them going forward. This only makes any sense when we talk about gender. If I identify as black, is it a decent person thing to greet me with a wagwan instead of a hello? Do you know what I mean? Like, we don't treat anything else this way.
Engage with me in certainly socially scripted different ways, right? And so this is what I'm...
Like, I guess this is how it's been pushed. I guess this is how we've proceeded with trans, but it shouldn't be this way.
I'm asking for a lack of the double standard things to be acknowledged and to be dropped down so that we're being even-handed across the board.
So let's speak about the regret situation because it's very, very complicated and almost impossible to...
Yeah, the problem is what we have to do is show why gender identity stands alone as something that makes sense to just call yourself and you are. You know what I mean? I go around saying I identify as a mule deer. You know what I mean? Like, I can't actually become a deer by any fucking metric. And is there anything to gain? Is there any social fucking gain from, like, fucking feeding me apples and, like, patting me on the head or whatever shit? Pretending I have antlers where clearly there are none.
To measure for these reasons. The decentralized nature of this healthcare, as we've already talked about, it's like the person that you go to, the provider that you go to get your hormone prescription is a completely different person than you go to get your top surgery, is a completely different person, provider, clinic, etc.
Oh, thank you, Blackie Cat. I will use it a lot.
That you go to get your orchiectomy or whatever it is you're having done. These are not centralized clinics. It is not holistic supervised care like it is in Europe.
I don't know if people are agreeing with Paul, like, in terms of no one should ever get gender surgery, or if they're agreeing with him more broadly in terms of things like not transitioning children and stuff. I don't know if they're like, I don't know. I don't really care that much. He's like, he comes here to scream at me and doesn't listen to a word I say and won't call in. So I don't know. Don't know what to do with people like that ultimately.
In the US, it's completely
Oh, wait, no, I do. I reacted to him talking to someone else, and he and everyone else should go and watch that. There we go.
just patient driven. And so if if somebody has gone on testosterone for 5 years and been like, shit, I hate what I look like now, I don't want to look like a man, I'm going to undo this, they're not going to go back to their endocrinologist and say, undo this testosterone, because it doesn't work that way. It's like you just stop. And if you haven't had a hysterectomy, your body just goes.
I'd be willing to bet that no one actually agrees with Paul that it's valid to ask me whether I pay for my broadband with my PIP, considering I don't have that. You know what I mean? I think it's probably a more general thing.
Back to producing the normal estrogen, and you just live your life as best you can somewhere in the middle. And some of those effects will slowly.
Right, as a virilized female.
Sure, but again,
right? And then like.
Yeah. So affirming Chris Chan is being a decent person according to Erudite. Yeah. Like, it doesn't have to be that way. It doesn't have to be the case that if someone identifies something that has like ramifications for other people. I think it shouldn't. I think people should call me whatever the fuck they want to call me, because I think that doesn't go down very well for other people. And there does in fact have to be some way that trans people fucking fit in with society, believe it or not. Integration is very important.
Your body just goes back to producing the normal estrogen, and you just. What I look like now, I don't want to look like a man, I'm going to undo this. They're not going to go back to their endocrinologist and say, undo this testosterone, because it doesn't work that way. It's like you just stop. And if you haven't had a hysterectomy, your body just goes back to producing the normal estrogen, and you just live your life as best you can somewhere in the middle. And some of those effects will slowly.
Right, as a virilized female.
Sure, but again,
right? And then like this being not reported in these stats is probably like irrelevant if these people are doing what is irreversible versus going and getting a surgery, which I agree, if you're going to a different doctor, would affect those stats. But just stopping a hormone, and like you said, if you don't have the hysterectomy, it's going to put you back pretty much to where you were before.
That is not true. Why? What is wrong with you? What is wrong with you? Why are you doing this? That is not true. Let's say that Aaron here stops taking his testosterone, and let's say he didn't have a hysterectomy, so his body starts producing estrogen again. His voice is not going to go back up. His facial hair is not going to fall out and never fucking grow back again. He might get some hair regrowth. It's clear that there's been a bit of like receding, but your mileage varies. The idea that HRT is as reversible as this person thinks it is fucking nuts. And I would love to know where he's getting this from.
Then
it's going to put your levels back. It doesn't put you back.
Yeah, put your levels back. Your hormone level isn't you. I actually can't believe this. Why did he call in on this? This fucking guy clearly feels some impetus to stand up for trans people and has listened to a bunch of trans people on the science behind it, which is an incredibly fraught thing to do because many trans people are incredibly biased on this. And it's just, it's so painful. Why do this? Why? You're not helping anyone. You're just spewing bullshit that people are having to fucking constantly correct you on instead of having an actual conversation. Like, okay, sure. Let's see how much of this guy's facial hair fucking falls out if he stops taking tea. That's not how it works. I will never produce testosterone from my testicles ever again because I don't have any. None of my facial hair stopped growing because of it. Some of my body hair kind of receded. I had to get electrolysis. I still get some facial hair. That will always be there unless I get more of it removed. Actually kill me. Actually just kill me. I cannot fucking deal with these fucking allies, man.
Sure, but
Aaron is saying your body will go back to producing. Aaron's saying your body will go back to producing.
We're doing the double standards thing again. We're doing the double standards thing again, right? The idea that it's impossible to capture desistance because you're decentralized. It's harder in America, but we capture desistance and dissatisfaction with desistance in multiple areas.
It's still not reliable because people aren't part of studies if they just drop out of them. They can't be included. That's fair enough. This was the mistake I made when I was talking to Alec Gunter, by the way. They can't really produce accurate fucking detransition rates, desistance rates. Because some people just fuck off. Hi, Twix. Hope you're good.
It just takes a little bit more like better thinking. And first of all, obviously, I don't want to shift this into a universal healthcare policy because I agree. Yeah, base universal healthcare, fucking better for research especially. It's way better. I agree with that.
I do believe a lot of people on the right will push for no transitioning now if they can, because that's how people work. They react in the opposite direction when pushed too hard. Yeah, we were talking about this earlier. Like, we can't just find some middle ground and find some compromise, because the other side has to be evil. So we have to push as hard as we can, as far as we can, And that just makes it worse. It makes the pendulum swing further in each direction to where it's almost never in the right place. Because how can it be? I don't know. I think the best, like in America, I imagine it might end up becoming like a red state, blue state thing, which is not ideal, but we need people to start taking some accountability that they're part of the reason why it keeps swinging this way, you know?
But the issue is that you're doing a bit of a weird slip where you're saying, well, because we don't have the same healthcare system, the results of the psychological ramifications of these treatments can't be generalized to American people. And it's like, well, that's not true. Unless there's something phenomenologically different between like American and Canadian trans people, other than universal healthcare. In fact, in the case of, in this case, I'm assuming that these are generalizing, especially because the study sample sizes are large enough to apply the generalization. You would need to suggest to me why, in the case in American people, their level of dissatisfaction with desistance would be astronomically higher.
Well, it would be higher because the treatment is different and might not have been ideal. It might be higher if people are just rocking up to Planned Parenthood and getting their fucking hormones there and then, if that's happening. I'm not saying it is. Like, if they're less discerning, if they're transitioning more people that shouldn't be transitioning, then yeah, that's a reason why it might be higher in one country than another. It's not really about the people or the concept being different or whatever from country to country. In theory, it should be possible to track in the UK because our healthcare is centralized. But even in the CAS review, one of the centers refused to provide the record. Yeah, aren't they doing another review now? Something like the Levy review or something. Because they asked for a bunch of records from the adult clinics. And they just wouldn't give them any. Like the gender clinics are a bit insane from what I understand. Like, I got all my information from my GIC quite a few years ago, or last year, I think it was. It was just last year. And like, there was some problem getting hold of my HRT for like GP reasons. The NHS doesn't like talking to itself. And like, at one point, they wanted me to re-refer because they couldn't find my data anymore. I had to resend all this data that I asked for from them like a few months ago. I had to send it back to them so that they could affirm that I had in fact already been fucking referred to them years ago so that I could continue my treatment when I'm post-op and I need something. It's nuts. It's crazy. There's a lot of incompetence. And unfortunately, when that happens, it's gonna make it more scrutinized. They don't follow up. They discharge people after surgery. Don't follow up with them anymore. What happens to them then is fucking God knows what. So we have a lot of like missing data as well, ultimately.
Well, I'm not saying that these are different patient populations. I'm saying that the way that the treatment is provided is completely different, and we can't measure it because it isn't being tracked. There isn't, like, I'm not saying that these are different people at all. I'm saying just the way the healthcare is provided is completely different. And it's not just a case of, so when you're talking about a double standard, it's like, this is where the trans population is being incredibly underserved and like, mistreated, is because there is no actual guidelines for, there's no holistic care here. It's entirely, well, it's up to you to figure out where you're going to get this, hormone, or it's up to you where you're going to get your, top surgery done, and these different providers.
Yeah, we're kind of approaching like patient-led care, stuff like that. It's not good.
Have their own different requirements, whether or not they're covered under Medicaid or take insurance or whatever. Like, it's just completely haphazard, and there's no oversight, and you don't even have to like really have a diagnosis of this condition in order to seek these interventions. And so when we're talking about
oh, we have the same surgeon. That's crazy. Yeah, I had mine done in like 2017. I ended up at a private hospital because it was like overspill or something.
Right. And like that 3% who go back to try to get a surgery reverse, basically no one does that. Like you have this surgery, you regret.
Yeah, you can't measure regret based on surgery reversals. Like, what surgeries can even be reversed? There is nothing I can do. If I want my penis back, that's it, mate. That's it. There ain't nothing getting that back. That wouldn't say anything as to whether I regret the surgery or not, though. I don't really, but if I did, if I can't reverse it, then do I not regret it?
The surgery, but you just go on living your life with your body the way that it is now, because it cannot be undone.
Why wouldn't you get fake breasts?
What's that?
Why wouldn't you get fake breasts? Like, say somebody gets a mastectomy.
Oh yeah, that's the same. You get a mastectomy way too young and grow to regret it. I'll just get fake breasts. I'll just get implants. Yeah, that's the same, isn't it? Yeah, great. Well done. Feed your kids through them. Go ahead.
mastectomy, the most common trans surgery, and they end up regretting it, what would be the process by which, like you're saying, they just go on living, they don't report it? Well, I believe that they don't report it to some degree, although lots of people do go back to their primary caregiver or go back to their endocrinologist and report like dissatisfaction. Endocrine specifically, I suspect, would be higher levels of people checking back in about desistance, because they probably want to know the safest ways for them to stop taking T or to start taking things, hormone replacement.
They often see a different provider. Well, because they, again, from the information, and we're all agreeing that there's a paucity of information here, but from the information that we do have, they don't go back to the same providers, even if they do. So I agree with Aaron that a lot of people, they just stop. And again, I don't want to turn this into anecdotes because it's not helpful, but like Aaron especially, but we've spoken to a tremendous amount of people who are trans, who have detransitioned, who have detransitioned and retransitioned and have been at all different points in this process. The majority just cease, and the ones who do seek care are looking for care from different providers. They don't feel like, and again, this is a lot of the providers, even the ones that they do go back to, tell them, there is nothing I can do for you, or I don't know what to do for you, because we have no protocols on detransition. So we have no protocols on trying to reset people or anything of that nature. And why wouldn't people go on to get breast augmentation? Number one, a lot of these people have what they conceptualize as medical trauma. They're not interested in doing any further risky medical.
Something I kind of wonder about: if you get a mastectomy, don't they remove a bunch of skin as well? Is it very easy to just get implants put in? Is that not like stretching out what you have left? Guess what happens to people that go back and report it, like Richie? They get gaslit. Yeah, that was some weird stuff. There was that guy, the one who killed himself, Yarden Silvera. His surgery got all fucked up, and like the surgeons, etc., that he went back to, didn't give a fuck, you know.
Interventions, which is understandable. It's also a lot of these mastectomies, they are taking out. I'm not a doctor here, but they are taking out everything. Okay, right. So it's making it a much more complicated reconstruction than to just have like a breast augmentation or something. So it's a much more complicated procedure once you've done a radical bilateral mastectomy.
Yeah,
yeah. I'm not saying that
the chest is very tight, and like with trans women, they take estrogen, they produce a lot of excess skin and flesh there that they can be filled out with fake breasts. But when you've had your existing breast tissue removed, and then then the skin just stitched around.
It's like he reads my mind. Listen, we're on the same page. It's interesting, isn't it? It's the trans person on here that's the one making most of the sense. I think Charlie's been fine as well. Like, he's making a lot of sense. There's an awful lot to consider. You can't just be like, oh, we'll just get implants. Again, it's these like well-meaning allies. They just don't know this shit. They just don't think about this shit because it's so like pinned on being a good person by supporting trans people. They don't think about all these issues. Like, you have to. I'm sorry. If you're gonna like advocate for a group of people, you need to know everything.
Like I've heard of one person trying to reduce or undo it, and she basically had like her chest inflated to a certain degree, and it was very painful to ultimately get like these little basically breast mounds that look nothing like actual breasts after the fact. And again, for that reason, basically no one
and are they going to be happy? Is that going to help?
seeks to undo a top surgery because just a lot more pain and heartache for something that's not going to look like your original body.
Probably most importantly, there's just no research into it, right? And so there probably is actual medical interventions that could be created, that could be offered to individuals, and there could be recommendations of a non-removal of mammary glands and future mastectomies if there's any chance of like potential desistance, right? I'm not opposed to any of these things by any means, right? I'm super open to that. Part of the reason that you're going to have with desisters in having any level of interventionism is because you're now talking about a microgroup of an already microgroup. There's already an issue with getting enough people to study in transgender research, let alone getting enough people to study transgender people who end up regretting and then desist research, right? And I'm not saying that it doesn't matter, that it shouldn't matter. The issue is that the desistance research shouldn't be used as argumentation to take away from trans care necessarily. We really should be holding these two things together because, again,
well, it should be like used to help it. It might end up less people being able to access it, but that's something that might be necessary. What if the detransitioners keep piling up? What if they keep seeing an increase on people detransitioning? Then something might need to be done. I don't think you can just blanket say, oh, well, it has to not affect anyone else's access to care. Well, maybe it has to. What if it has to? What if you get to a point where a certain amount of people are very much going to detransition and they're not going to be happy and they're going to have gone through all kinds of things? Is there not going to have to be a conversation eventually? And it always comes back to this attitude. Well, we can't talk about any of this because it might risk other people's healthcare. Well, I'm sorry, you can't just do it that way. It doesn't work. What you're advocating for there is brushing those people under the carpet. Well, then how are things going to improve? When you get the people that constitute mistakes made in this care, in screening especially, and you sweep them under the rug. It doesn't make any fucking sense.
And there are plenty of people who come to regret even things like hip surgeries, but that doesn't mean that we don't make recommendations for hip surgeries. We look at the issues that people have had in the past.
How is hip surgery comparable? That person probably needs a new hip, otherwise they can't fucking walk. Yeah, it's probably going to be painful. Yeah, they're going to have to go through all this physiotherapy so they can walk again. Yeah, they might feel regret because it's like, oh, I could have just sat in a wheelchair the rest of my life. It's just not comparable. Someone isn't getting hip surgery because they have dysphoria about their fucking hip, are they? It's not related to a mental health issue, typically. It's related to a physical issue.
And we update hip surgeries to try to make them better implementable into people's lives.
This is not what we're doing with detransition at all.
So I agree with you. I think, okay, there were a few things there, but I'll just start at the end. So the comparison to other types of interventions like hip surgery, like IBD interventions, like cancer treatments, the difference here, the comparison is more apt when we're talking about depression and anxiety and schizophrenia and things like this. But when we're talking about medical complications that we have a strong evidentiary basis for the issue, for the disease, for the problem, that is very different from what we have with gender dysphoria because it is.
No, it's not in this case. When we're talking about low to moderate evidence, we can really do things like comparing stents in like non-acute anginas.
We can't because these things are entirely different in kind. They are characteristically entirely different. So we're talking about a cognitive and psychological phenomenon with neurocorrelates with all these other things as compared to someone with a broken hip, right? Or cancer that is like spreading and proliferating in their body. So, I'm not saying that we should get rid.
Just to pause you, I want to back us up.
Oh, I hate when people do that. Don't do that. That straight away, like my fucking teeth set on edge. That made my fucking spine go. Oh, I hate people that do that so much.
Pause you. I want to back us up. Nowhere at any point is the analogy of a hip to transgenderism, because I think being transgender is like having a deteriorated hip.
Then why compare the fucking surgery regret rates? Then what use is that?
Right? The comparison, the analogy that's being made there is interventionism, the level of intervention.
But the conflation even, you're saying being trans and have.
But that normalizes them as the same basic thing in some way. Like, oh, it's so painful. Oh, man. Listen, here's the thing. Usually when I've heard like erudite talking about something, it's about something I don't know a huge amount about. I'm probably like chilling late at night, playing video games and watching fucking Queeman or something. And like half the time I'm zoning out. I don't know what the fuck she's talking about. When it's on a subject more well-versed in, it's actually painful. What the fuck are you talking about?
Having a busted hip. No, it's gender dysphoria, right? It's sex dysphoria and having a busted hip. And and the way that we can actually determine and diagnose these things.
Tally, if you're being good faith with me at all, obviously you understand that when I'm saying being trans, I'm talking about gender dysphoric people because I'm not
and clinicians who are raising.
But that's not what trans is. So we just get to flip back to like trans medicalism whenever it suits us. Crazy how she'll say stuff like that, but also claim it's life-saving. Yeah. Like the life-saving thing is so stupid. I'm sorry. There's a slight reduction in suicidality, therefore it's life-saving. That does not make any sense.
Faith with me at all. Obviously you understand that when I'm saying being trans, I'm talking about gender dysphoric people because I'm not.
And clinicians who are raising their concerns. That is not the motivation of a lot of.
Okay, I don't know what happened just there.
Trans people who are raising their concerns. And so I think the good faith needs to go both ways, basically. There are a lot of people who are sincerely concerned about these things, and it's not because they don't want to touch the trans identity thing.
But Talia,
right, but again, I just got to go back. I got to hold my frame here. When I'm talking about the identity piece, I'm not saying like I'm not being bad faith and saying you guys just hate trans people, right? That's not what I'm saying. I'm saying that there are double.
If you're going to start with the bad faith shit, then expect it back, right?
Standards of expectations of evidence for trans interventionism that get outlined in things like the CAS study and in this argument here that we do not hold the same standards for other invasive protocols.
Because they are different conditions.
Of course they are different conditions.
Yeah, why would you hold every single condition's treatments to the same standard? Wouldn't it kind of vary depending on the condition, the severity, what's likely to happen if you don't treat it? Like, what happens if you don't treat cancer versus if you don't treat gender dysphoria?
conditions, but we have to analogize some things at some times and draw levels of comparison, right? And so the reason
But why that comparison? You haven't justified that comparison.
that I'm submitting as to why we have pediatric care with low to moderate evidence and high levels of interventionism that people are
When you first listen to Erudite, you think she's okay because she's not a raging feminist. I think sometimes she plays up the raging feminist thing as well. The more you listen, the more you see she's dumb as fuck. Yeah, Jesus Christ. It's like painful to listen to. I do get like Sood vibes from her. And like, I understand why these people are like this and why they exist the way they do and show up to these debates to push what they do. I'm willing to be reasonable and say they're not just shills. They're not just like fucking audience capture freaks. Like, oh, my audience is trans, therefore I must trans affirm. I don't think it's necessarily like that. But there's clearly a lot of like knowledge missing. And there's clearly like, it's all the same rhetoric. It's like what we're doing almost. Like we take this like shitty as fuck trans rhetoric off of Twitter and then like intellectualize it and try and make it make sense. It's all the same talking points, just with more words in between. And just an attempt to find a bunch of studies that join the dots for you. It's so weak. Like, why would you put gender dysphoria on the same scale as like having a broken hip or like cancer?
are just okay with and they're not okay with trans stuff is because of that identity piece. And it's not because I think people, like, I don't think you guys are trying to attack trans people and say that they are bad and don't exist. I'm saying the psychological element of the identity piece makes things feel bigger and therefore people don't engage with them in like fair levels. So when we're talking about interventionism and invasiveness, then we have to compare it to the closest that we have, which would be other invasive things and the level of evidence.
We have to compare it, but it's like one-to-one comparing it.
That we have for these invasive things, and if we're holding everyone to similar standards, right? That's what I'm talking about.
Then we need to do that. We need to do that. Fine, but then we need to.
I just don't think this really justifies like the level of comparison.
Can I supplement this too? Just one last thing. Can I just supplement? I don't want to add another argument. I just want to just like really shortly, like, because Erudite speaks longer than I do, and I'm a slow, simple man. So my understanding of this too is that, yeah, with something like knee surgery, right? This is something that is like not analogous in the same way to gender dysphoria as we have like empirical, concrete, like, here is your fucked up knee, right? Versus like, hey, this is a psychological thing. It's much harder to diagnose. And in these surgeries, we're seeing a higher regret rate, but we're not using this as an argument to take away knee surgery. It's an argument to, hey, maybe we need to improve.
Well, yeah, because what's the alternative?
These surgeries, or maybe we need to do something different here, and not, hey, this is a reason now we should never do this again, or that we should make this even harder for people to get. Just, hey, this could be worse, and even for a more empirically severe condition versus.
I mean, all of this is moot when the regret rate is so nebulous anyway.
Gender dysphoria, where it seems to not have the same regret rates to the same extent. Maybe that's understudied, but that's not an argument to not give the care to the people who are clearly reporting that it makes their lives better.
Sure, and I appreciate that you brought up the difference.
People are clearly reporting that their lives are made better. Yeah, the suicide rate remains high. Yeah, the evidence is actually very mixed. And like, even basing things on people's testimonies only goes so far. It's only as good as any one of those data points are honest. I think data on like trans, especially when it comes to regret rates, things like that, how happy you are since you transitioned, I think they're very suspect. I think people are biased because of how political it is, how politicized it is. We see how people act whenever someone says anything out of kind. I talk to Amaya sometimes. I had Amaya on my stream yesterday, I think it was. She got absolutely pilloried for saying, hey, I think the detransition rate is probably a lot higher than we're saying. That's all it takes. So yeah, I think there is a certain bias instilled. There's a certain feeling like we should say certain things. We should have certain opinions. You know, we should feed the confirmation bias, because if I'm not happy, maybe it's for reasons. Like, it's so dicey.
There, because that's what I was trying to say, is if we're going to do these comparisons, and I agree we need to be fair, but we need to consider both of the axes here, right? So we need to be fair in comparing it to other low to moderate efficacious interventions, even of the same level of intervention, like you're saying. We also need to compare it to the type, I wish I had better, smarter sounding words here, but the type of diagnosis of issue that we have here, right? So we also need to look at it.
Construct itself, yes.
Sure, right. We need to compare it against other cognitive and psychiatric disorders, not just these medical, not just these medical diagnoses that are much clearer to diagnose, if not much clearer.
I think one thing you could maybe compare it to is like antidepressants. You could say well, antidepressants don't always help everyone, stuff like that. I think the difference then, though, is it's a much less invasive thing. It changes far less about you. So even that isn't a good comparison.
To treat, and again, I want to reiterate, I'm not trying to take this care away.
And no one talks about why people regret knee surgeries versus why people regret gender affirming care. Why do they regret either of these things? No one talks about that. It's just the fact that they do. The more I watch of this kind of shit, the more convinced I am that so many of these people, they just see that the evidence says a certain thing and they stop there. They see some stupid soundbite on Twitter about knee surgery regret rates versus trans surgery regret rates and just stop there. Oh, well, that's what it looks like. They see that some trans women's brains might kind of look a bit more like a average woman's brain. And they stop there. Well, this is what it looks like. They don't give a fuck about why any of this exists. Why people regret knee surgery versus gender affirming care. Isn't it going to be very different reasons? It's so painful. I don't know how to get this into people's heads.
I have very severe issues and concerns with the framing of this care because I don't think it's an honest system right now. I think it's got lots of good intentions, but I don't think the system is honest and working in the best, is working best for trans people. So I want trans people and people with dysphoria to have access to HRT. I want them to be cautious with surgery, especially with bottom surgeries, because these are very risky, but I want people to have access to all of these things. I don't think the current framework that we have right now is working. And again, I'm not even necessarily asking for
When
higher
you say
levels
it's not
of gatekeeping.
working,
I think
what
we
does
need
that mean?
transparency. We need transparency in what the data actually is. We need transparency in what the process actually is. Right now, we have a system that kind of funnels people into the next intervention, like Aaron is saying, with all of these things very separated and without a holistic, cohesive intervention plan. And also the types of things, here's the thing too, and again, this is perhaps controversial, but it bears discussing. Even looking into the low to moderate evidence that we have, we need to look at what they're actually measuring, right? And what these constructs are. And so we don't necessarily see improvements in things like career aspects, like interpersonal relationships, like overall health functioning, like depression, like anxiety. What we see very often in these studies is a low dissatisfaction rate, a decrease in reported gender dysphoria, and
Yeah, there's a lot of this well, it's not working, you know?
an increase in
That was pretty much what Joanna Olsen-Kennedy was doing.
self-reported satisfaction, basically,
Okay,
and
but
quality of life.
Tali,
And these things,
to finish your statement, but then I have a question for you, please.
these things are important, but even then, right, we need to tell people exactly what they can expect. And we need to be really looking down at what these constructs are. And so like we said, there's already just looking at satisfaction is not the most important thing, in a similar way that just looking at people's satisfaction or regret with a knee surgery that might have been medically necessary, even if it's risky and has all of these other negative side effects that people come to regret. I want to take a specific example. So, Wick, I don't know if you want to intervene with your question, but I want to go sort of deep into one of the measures just to kind of highlight what I think these problems are.
Okay, go ahead. But I guess while you do that, have my question in mind. Let me get it out before I forget it. You keep saying things, and I hear you and Aaron say, like, the system's broken, the system's not working, the system's not doing what it should do. And what I hear from you, and when I ask that, like, what's happening, it seems to be the answer that you give is, well, we're not measuring these things as much as we should be. We're not recording these things as much as we should be. The reporting on this is bad. And that's fair, but I don't know if that means that it's broken necessarily. If, as you say, that most people who go through these treatments, it seems to help them, then why would that not be working? Go ahead.
So again, like, it seems to help them in some ways and not necessarily always. But the problem, I think, what me and Aaron are alluding to, is we don't really know exactly how many people it's helping and to what degree. And because of many of the reasons that people already brought up here of the concern about this healthcare being weaponized against trans people and being taken away from them, even within the trans community, it's an open secret that people don't talk openly about surgical complications, about complications that they have in transition, because they don't want to take the opportunity away from somebody else.
Yeah, Ryle Kittenhouse is a YouTuber. He does a lot of edits of Jay Stalk and people like that.
Says it didn't work for me, but I don't want to take this away from somebody else. And this works to the detriment of other trans people. And again, there are people who are open about this, and it's for a very good reason.
Can we pause that right there? Because I agree. Yeah. I understand what you're saying. When you say, look, there might be someone who would otherwise have not done it because they hear a story from someone who has some sort of medical complication, like with a plasty or something like that. And I'm sure that would cause harm to that person who might have...
I'm sure it might happen, but in general, it seems like...
discovered that. But that's not an argument to get rid of the care, because the reason they're
don't want to get rid of the care.
I know.
Yeah, she doesn't want to get rid of the care, you retard. Why do they always go back to this? When all else fails. well, I agree with literally everything you say, but you can't use it to stop trans healthcare when no one wants to. Kill me.
Saying, sure, hold on. I'm not saying you do, but it's like, this is an argument to say that, yeah, we should inform people that there are possible complications if they're going to go through the surgery, which is also what we've been saying since the beginning. Like, yeah, there should be some sort of holistic, multifaceted, multi-step process with psychologists and doctors that say, hey, we're going to make sure you understand completely what is.
The problem with this is they can say this kind of thing as much as they want, but they're also in favor of the status quo continuing and presumably continuing to transition children and stuff like that, you know? That's what I don't get. Oh yeah, I agree, we should improve things. Well, it's like, well, we're still forging ahead with stuff that is just not seemingly a very good idea, you know?
Is about to happen to you if you want to continue doing this. But to say that this is like harming them on a grander scale than if those people were weaponized, which they are, a lot of detransitioners are weaponized, to
detransitioners are weaponized. Like, fuck me. Is this guy on Twitter? Is this guy on Blue Sky? Detransitioners being weaponized. Well, half the reason they get fucking weaponized is because they get pushed towards these people's like political rivals. Because these like lefties and trans people don't want to know about detransitioners. They want to hide them under the rug. They want to sweep them away.
take away the healthcare completely. I know you're not advocating for that.
That's how they treat all detransitioners. I'm sorry, man. I'm sorry. That's how it is. These woke fucking trans people and their allies, they do hate detransitioners. They only see them as something that might cause problems for trans care. They don't care about the actual people. We watched it all go on with this Hendrix person. He might actually be going through some fucking shit. I don't like this person either way. He was a fucking cyberbully as an activist type of person. And from my conversation with Amaya, doesn't seem very repentant about it. To be honest, I haven't spoken to him personally, so I don't know, to be clear. But that's all people have to say. They don't talk to these people anymore. These people are like enemies now. And they still want to tell them, oh, well, you can't do this, that, and the other because that's bad. Or face reprisal or whatever. It's disgusting. I'm sorry. That's how it is. Someone like this, I doubt he gives the slightest fuck about detransitioners. All he sees them as is a potential obstacle.
I would say that's much more of a concern if we see the positive outcomes on a larger degree for most of these people versus the negative ones.
Yes, much more of a concern. And neither of those are good reasons to withhold data or to withhold information from potential clients, from providers, from the general public, from the scientific community. And again, this is what we are actually seeing.
Like, whether they get weaponized. How many trans people weaponize themselves or are weaponized to push transitioning children? This can go both ways.
Amongst top researchers in the field is they are withholding the data because it doesn't show the excessively positive outcomes. It shows neutral to moderately positive outcomes. So I want to hone in again on one specific thing. So I'm assuming I told you guys about this last night, but I'm assuming, at least Kyla, that you already knew about this. But the youth gender affirming care, the model that we use today, the very different model that we use in the United States, originated in the Netherlands. It's referred to as the Dutch protocol. And these were the first researchers to use puberty blockers as a staged intervention for kids with gender dysphoria. And essentially, it was taken to be this great success. It was brought over to the UK. It was then brought over to the United States, and it's proliferated all throughout Europe. And this is the research that started this intervention for children. If you actually go into the research, you see that the number one positive outcome, the highest positive or increase, right, positive effect, or in this case, it's a decrease, was a decrease in gender dysphoria. Okay, they showed a significant decrease in gender dysphoria and an increase with satisfaction with their body and with their gender. When you go into the methods, the measure that they use, it's like the Ulbrecht gender dysphoria scale or something like that. I forget the exact name. This measure is a sexed measure, right? So you give one measure to males, one measure to females. It's asking you questions like, I feel really uncomfortable when people recognize me as a man. You know, I get upset when I'm expected to do things that men are supposed to do. Having a penis, you know, makes me distressed. Things that are completely sex specific. They do the intervention of puberty blockers. They go on to cross-sex hormones. Many of these people go on to have additional surgeries. They then give them, in their follow-up study, they give them the Ulbrecht gender dysphoria scale, and they just swap sexes. So now females who don't have penises. Many of them don't even have phalloplasty, right? So I'm not trying to shit on and say, oh, your phalloplasty is not a penis, although it's a conversation we could have on a separate day. Most of these people didn't have these bottom surgery interventions, and they were being asked questions about, so there you have a female saying, well, no, my penis doesn't cause me stress. No, being identified as a man in public doesn't cause me distress. No, being referred to as he, him doesn't cause me distress. And so they saw
I mean, I'll just grant you.
Sure, let me just finish it really quickly.
Well,
so they
sorry, you
saw a
just
ginormous
like 5 minutes. So if I could just jump in.
Why is it always Tali that Erudite interrupts? It's interesting, isn't it?
If I could just jump in and pose you a question, just because you've been cooking for a hot minute, right? Sure. I'll just grant you that the Dutch model, one of the original measures was was poor, right?
Yeah, the Dutch model that all of this like treatment for kids is based on, by the way. 2 kids died.
Just grant you that as a psychometrist, right? The issue is that I would be extremely dubious that hasn't been replicated since then with higher quality studies, which my understanding of like life satisfaction measures are vastly different now because I've looked at a lot of them and they're much more of what I would expect in any life measure standards. They'll use lots of GAF things, all great measures that I'm happy for them to be using. And despite, sure, the Dutch model being the one that we based it on and the one that maybe has the methodological issue, since then the replications have been done with better quality studies and we're still consistently seeing
There was a UK study that tried to replicate the Dutch model that failed. Wasn't there like studies in Sweden and stuff as well? It's not been consistently replicated. This is bullshit. It's not true.
We are just seeing a broad amount of evidence, even though you might not like the quality, the broad evidence that we have that is of any level of decent quality is directional to suggest that gender affirming care does improve quality of life.
This isn't even necessarily true either.
It does reduce distress and it does reduce dysphoria by and large, although there are cases where this isn't the case and it's not as robust as maybe we would like it to be, which is typically the finding with any care measure, by the way. DMT was fucking everything and we thought it would cure PTSD until we started doing it all the time. We realized, well, the effect is a little bit more in between, which is to be expected in standard of cares. So the Dutch model...
And then we walked it back. And then we walk back. It's similar to like.
Hold on. No, you did not walk back DMT treatment at all. DMT treatment is still offered all the time. Ketamine treatment is an extremely pervasive thing.
It's not a first line treatment for depression.
It was never a first line treatment for anything, and it was never purported to be.
Okay, well, again, so sure, but gender affirming care is the first line.
Why is she bringing this up then? Like, I don't fucking get it.
Treatment for trans healthcare, and we're seeing similar low to moderate levels of evidence for the efficacy of these interventions. It's like lobotomy.
No, it's not.
Yes, it is. Yes, it is. When you look at the WebPath recommendation, it recommends therapy and social transition long before you go through any medical procedures. And the puberty blockers.
Social transition makes you much more likely to go onto medical pathways, though.
It doesn't happen.
The puberty blockers have never been treated as gender affirming care. They've exclusively been used for the wait and watch method to ensure that there is more time for all of the other interventions.
And they overwhelmingly go on to them. The more time thing is bullshit. The whole point is to stop their puberty so that they can take a different hormone. So that they can not go through the other sex puberty, because that's impossible, but go through something appropriating the other sex puberty. It's not about buying time. It's about avoiding male puberty so that male to females don't have to deal with like the lower voice, doesn't have to deal with the facial hair and shit like that. It's not about buying time. This person is just eating up the propaganda wholesale. I'm sorry, man, this is bullshit.
Interventions that are
Can't wait to get into that part.
Effective or not effective, right? And so the idea, like, okay, go ahead and respond.
Well, okay, so puberty blockers are
absolutely. Go ahead. Yeah. I just want to make sure Aaron gets a chance too. So.
Yeah.
Oh my God, shut up, Wick.
Aaron's used to me talking over him all the time. Puberty blockers are absolutely part of gender affirming care. So I hear what you're saying. They have different.
They're not part of gender affirming care. I said that they are not specifically gender affirming in their care. They are used in the gender affirming spectrum.
They're not specifically gender affirming. Oh, fuck me. What are you talking?
Used in the gender affirming spectrum as a wait and watch perspective. It is a window.
It's not just a wait and watch perspective. If followed through to hormones, it's way more than that, because you've completely stopped their ability to go through their natural puberty. It's part of it. And every step makes the next step more likely. You have to treat it as part of the chain as well.
To give space for the kiddos to have other non-invasive interventions first.
So I understand what you're saying. That distinction is absolutely correct. We don't expect dysphoria to go away when someone goes on puberty blockers the same way we might expect it when they go on HRT. So I think that's the point you're making, and I completely
Yeah, at best it's kicking the can down the road.
agree. We have a few problems with puberty blockers. There's actually, again, I'm against youth intervention full stop, but there's actually evidence to suggest that the safer path for even youth, basically, who are severely sex distressed, would be to go straight on to monotherapy, HRT, and to not do puberty blockers. We have, hold on, let me just get the
That's how you're just citing CAS. But the issue is that
I'm not just,
90%, 98% of people that go on puberty blockers go on to get transition therapy, right?
Yes, exactly.
Right? That's the position that we're moving towards.
Okay, yeah, hold on.
How is it time to wait then? It's just part of the fucking process. It's not time to wait. It's not fucking time to wait. There's a very clear effect that is had from it. It's part of the process.
And hold on. Yes, but that's not the reason I made that claim. So that's another claim that I was going to make. So yeah, so the idea behind puberty blockers was time to wait. There's an excellent book about this by Hannah Barnes. She's a BBC journalist in the UK who wrote about all of this going on in the UK, basically. Her book is called Time to Think, and that is what puberty blockers were set out to do, to give a young person time to think before they make such a huge, potentially life-altering decision, let them figure out what their gender identity is, and give them a pause on puberty before their body starts making its own irreversible changes through puberty, right? That was the desired goal.
Yeah.
What they found.
Holly, can I just grant you, like, obviously it's not considered gender affirming care, but if you want to talk about the way that puberty blockers are used in the sense that going through puberty might exacerbate some sort of gender dysphoria, I understand why people call it that, even though that like semantically they are different. Like, that's fine.
I consider it gender affirming care. Yeah.
It's part of it.
I'm not trying to nitpick so much with the terms, but so that was the intent, was to give kids time to care, time to think. We have no evidence that it actually did that, right? If anything, it seems like it plays as the first step in the intervention, right? And
yes, exactly. Fuck me. There we go.
so in the UK,
Just let us speak. Let us finish the fucking point and then jump in.
where they actually have centralized information and they can measure this stuff, all but one kid who was started on puberty blockers went on to cross-sex hormones and to transition. And so
the first step was not the first medical step. Might have been puberty blockers, but before that, there are
sure, but that's so far beyond my point.
Well, no, because you're acting like it's just this thing that you're going right away in, and not, hey, before you do any of this stuff, you've got a team of psychologists and doctors that are making sure that you even should go on this at all, right?
What does this matter?
Like,
that's not true.
Aaron, you're shaking your head.
Especially for puberty blockers, because of the time constraints. Especially for puberty blockers, because of the time constraints, they want to start you on it. And a lot of these kids are not coming in at 10 or stage 2. They're not coming in at 8 and 9 years old. They're coming in at 12, 13, 14 years old. They may have already started puberty.
Is the implication, because maybe this is true, and I don't believe this to be the case, that these kids in the UK, in the system where it's studied well, because Aaron, I saw you shaking your head. I understand there might be places, because this is not as robust and connected in the United States, where they don't have these checks in certain places. I understand that. But in the UK, is the case that people are going in and like within weeks, they're just like, bam, puberty blockers, no other sort of analysis whatsoever. Like, oh, you said this? Okay, I believe you. Here you go. I don't think that's what's happening, but maybe you can tell me that's wrong.
How would you know? Oh, it's so annoying. What is he arguing from? Where is he arguing from? How would you know that never happens?
In the US, it's within the same day. You show up, you say, I'm trans, and puberty blockers are all they can do.
I understand that might be the case.
You're asking about the UK.
I'm asking about the UK specifically for the study that Talia is referencing first.
So in the UK,
Like, weren't there so many stories about like people getting sped through on the Tavistock clinic? I'm sure about this. Like, geez, I need to brush up on my Tavistock history.
they ran into a very serious problem of basically they had a shortage of clinicians to deal with this problem, and a huge boom in the number of kids who were coming into their clinics. And so their standards, their protocol was supposed to be a much longer thing, like you're talking about 6 months or whatever of therapy and stuff. And so oftentimes, time-wise, that is what was given. So it would be 6 months to a year or something of waiting. But because of the wait list to get into these clinics, and because of how busy their schedules were, these doctors may have only seen them for a total of 1 hour in a full year period before they were given these interventions. And so it might, in a lot of the cases, it satisfied the time requirement, but not the way the time requirement was written into the protocol, right? The protocol was that you're actually having therapeutic intervention, that you're having a thorough assessment, and not because these doctors wanted to hurt anybody, but because they literally didn't have enough people, they didn't have enough time in their day or enough people on their staff to adequately service all these kids.
Okay, so even if I'm willing to grant you that this is the case for some of these people, what I'm seeing
you should read the book. It's excellent.
Well, let me just look.
I very much doubt if this person has read anything or like looked into any of this. I am 99% convinced that he's just been told a bunch of stuff by trans people, which isn't like, it's not good enough.
I'm just trying to axiomatically like follow the train of logic here and tell me if this doesn't make sense to me.
Sure.
So let's say that maybe this is not as strenuous as you would like it, and maybe if that's the case, it's not as strenuous as I would like it. But all of these kids who did go on these puberty blockers, you said only one of them was not then followed through with a higher level of gender affirming care past that. And then also additionally to that, when surveyed these people to say low regret rates and positive effects on them. So maybe there are some
I mean, the other thing is, like, regret rates on, like, puberty blockers and stuff. Is there any point in even measuring that? When there's still so much more stuff to end up happening, you know?
Incongruencies and bad things happening here, but like it all seems to laid out as, hey, these people got what they wanted and they're very happy about it. I'm very confused as to the...
Yeah, so what does that even mean then? I got the treatment that I went in asking for, and now I've got it. So yeah, I'm happy. But that's just part of the process. What about when it keeps going? What about when you go on to your hormones? What about if the effects aren't really that great and you don't end up passing? Like we talk about how, like, with puberty blockers, males are supposed to be able to pass so much better. Not many of the people that I've seen that were on puberty blockers pass all that well, unless they get loads of fucking plastic surgery done. Like, it kind of seems like a lot of it's just kicking the can down the road. And measuring regret rate at this kind of earlier stage is a waste of time. Like, yeah, they're still on the procedure. That's why I think it's worth looking at, like, how regret manifests in, like, post-op people. That's why I think it's worth looking at. There was a massive study, I think it's J. Lewis from 2025, where, like, they were finding that people who had undergone gender-affirming surgery were more likely to experience certain things like anxiety and depression. Because at that point, the procedure is completed. There's nothing else to look forward to. Now you kind of are what you are. Most of them can't afford additional steps like feminizing facial surgery or whatever. So it seems a bit worthless, honestly, talking about the regret rate of, like, puberty blockers in, like, children.
So if we're just giving people what they want so that they'll be happy, again, I'm okay with that. That's more in line of the true informed consent model that I'm pushing for, but that's not how it's being built. It's being built as life-saving medical interventions based on some recognizable medical diagnosis. So yeah, if the standard is, if people want this, they should be able.
The other thing is, there just really isn't very much evidence that these kids are actually killing themselves en masse because they're not getting hold of, like, puberty blockers or whatever.
To get it, then we're satisfying that standard. But that's not the standard that these people are purporting to hold themselves to. And so yes, only one person out of all the kids that they saw who went on puberty blockers didn't go on to cross-sex hormones. This already is a huge difference from what they saw in the Dutch protocol and even what they do in the Netherlands today, where they said something like a third of kids that they assess and that go on puberty blockers, they do not put forth to the next step. Another problem is we don't have any type of rigorous assessment. And so it is literally, if the person is insistent enough, that is what we follow. You are literally not allowed in many places in the UK and the United States, you are not allowed to challenge someone's self-report because the identity factor has come in and started to play a large role here. And so
Michaela,
we have
what do
all
you
of
mean
these.
by you can't challenge? Like you're not allowed to question whether or not they have gender.
Yeah, you could literally get in trouble with your supervisor and be taken off the case. There's lots of
Affirmation is the only option.
Correct.
It's all.
Well, hold on. That's not the way that we should be phrasing this. I would agree that you cannot be pushing back because conversion therapy has such a nasty reputation for good reasons, by the way. Which, by the way, if you guys want.
Yeah, and now we're trying to label anything we don't like that isn't affirming as conversion therapy. We can walk up to the point so many times and then, like, slip out the back door again. It's so painful to listen to.
Want conversion therapy to be effective, you should be mad at conversion therapy fuckers for being so fucking evil this entire time, right? The reason why the pushback model is so hated is because it was so abusive for so long. And so it's not affirmation. It's almost exclusively exploratory. A therapist would also potentially lose.
I think this is true. The affirmative model is what WPATH pushes. How does she not know this?
Their license if they had a client come in who said, I'm not sure what gender I am, and they go, you're probably trans, right? And so that's not what's happening either. What they're having is exploratory therapy, which, to be clear, is most standard therapy because it's not.
No one's having exploratory therapy. Almost no one.
Yeah, I don't believe what Erudite is saying here. I think she's making things up.
Kyla, I wish they were.
What do you think I mean when I say exploratory therapy?
Exploring where are these feelings coming from? You know, talk to me about your life. When did these feelings start?
Yeah, talking about other issues. Like, that's exactly what Tali is describing and what I presume Erudite is hinting at. That is the shit that gets called fucking conversion therapy as a way to discredit it so that the only thing left is the affirmative model. Like, you've been shilling WPATH. Didn't you read their guidelines? Do you know what they're about? It's affirmative care. It's about affirming. It's practically a fucking patient-led at this point.
have you considered other things? Have you experienced any types of traumas? What's your relationship history like? Taking a holistic look at the person, trying to understand where their dysphoria is coming from, how stable it is in their life, how distressing it is to them, and if they're a good fit for treatment. That's what exploratory therapy should be, and there's no version of that happening in the overwhelming majority of clinics.
I don't see evidence for that. I would grant you.
You don't see evidence for affirmative care being the way that it's done almost every time. You don't see evidence that they're not using exploratory therapy. Like what? This is actually so fucking stupid.
I don't see evidence.
Therapy. Hold on, Kyla.
This is just being obstinate. You want to stick up for the status quo. You'll do anything. Why? Which trans people have got your fucking ear?
Tally, breathe. You gotta let me talk. Sure. What I'm saying is I don't see good evidence for this. Well, I believe that there are absolutely going to be licensed mental health practitioners that are stupid and bad at their job and are just there to yes man their clients.
That's the fucking model, bro. You've been shouting out WPATH the whole time.
Large, that's viewed as a very bad thing to do. And most supervisors, even supervisors in very...
That's not true. It's not viewed as a bad thing. Affirmative care is the model. It's the status quo.
LGBTQ affirming spaces are not going to necessarily go around and tell you that you are indeed trans. As somebody, again, I have lots of anecdotes of trans people in my community as well who have gone to therapy.
Okay, trans people in my community. So people are filling your head with shit. That's what's happening. You're sticking up for them. You're not actually having a debate about whether trans healthcare is good or bad or whatever the fuck we were supposed to be talking about. That's how these people do it. Oh, well, I've got trans people in my community that I care about and I trust their opinions on this shit, so I'm just going to spout them and just be obstinate whenever someone points out a problem. Oh, well, I'm sure that happens somewhere, but I don't feel like it's normally the case. Like, okay, bro, okay.
And most of their therapy as people exploring their gender identity was exploratory in nature. That, like, I have multiple friends that went for almost 2 years before they decided whether they're going to transition or not. And these individuals, one of them decided not to, and one of them did. But they were given...
What, so they hadn't decided at the time, so they weren't going in being like, well, I want to transition, I'm trans, I want this, that, and the other. Well, if you go in saying you're not sure, they might not affirm you. But that's not overwhelmingly what people are doing. They're going out and saying, I want this treatment. And the doctors are saying, yeah, okay, sure.
I helped them find LGBTQ, gender-affirming care, gender-affirming therapists, and the therapist sat with them and let them figure it out for themselves because therapists aren't rushing to get you transed. They're not. And some are. There are some bad...
Also, it's selection bias. People who are in erudite's community are more thoughtful, armchair intellectual types who will do exploratory therapy. Yeah, I know what you mean.
Actors, because there are always political bad actors. But the issue is that most of them are not doing this. They are doing the exploratory thing, even if they probably have some level of bias of never wanting to say, no, maybe you're not trans. And I would agree they should be allowed to do that too. I agree with you in that regard. But the idea that like everyone is getting people into their clients and just being like, yeah, you must be trans is just not really borne out. And that's not really...
Well, no, that's not what's happening. People are coming in saying, I'm trans. And the therapist is saying, you're trans. Not... here's my story. Oh, you're definitely trans. It doesn't work that way. Most people go in saying, this is what I want. So we're like twisting things all up right here.
Really what therapy looks like ever.
So yeah. I've attended multiple conferences.
And of course, the licensed graduate therapist, whatever the fuck she pretended she was. Of course she knows how therapy looks. How does it look when someone just goes in, I want this? I think the people that you've been talking to probably do have a different experience from the average.
For gender affirming therapists and other gender affirming healthcare practitioners, and the therapy you're describing just does not happen. They're not allowed to do it.
Yeah, kids are being led on to believe that they're trans in school. Lots of problems. By the time they get to the therapist, their mind's normally made up.
The only thing that they are allowed to do is this person says, I am trans. From that moment, your job as the therapist is to help them facilitate their transition. That is it. There's not any sort of any exploration around this person's experience is framed in terms of their adverse life experiences due to their transness, due to living in a cisnormative society that is constantly oppressing them and invalidating them. Everything is tailored around cultivating and affirming the trans identity and facilitating the medical process. That is what they are taught their job is. I was at the psychological, what's that? The American Academy?
The APA?
Anyway, no, yes, the APA, yeah. And as they were developing the guidelines for treating
Yeah, the APA is very captured, by the way.
gender, I think they're calling gender diverse patients. And that's literally what they were, everything was affirm, affirm, affirm. I asked, again, my standard question, how do you determine, which person is, like a gender nonconforming cis person and which is a gender nonconforming trans person? And they told me only a transphobe would ask that question. There's no answer to actually doing an assessment. They're not allowed to actually do assessments. It's just, you're trans, great, let's get you trans.
Yeah, what I'm pretty sure Erudite is talking about is people going in that are much less committed, much more non-committal. Well, I'm having these feelings, those feelings. Yeah, they probably would have an experience similar to what you're saying they have. That's just not how most people are presenting as trans.
Transitioned.
And I want to follow up to the people that you're talking about, Kyla, for example, the anecdotes that.
Great, let's get you transitioned.
And I want to follow up to the people.
She's like shrugging, shaking her head, but she won't dare interrupt him. But when it's Tali, she'll just jump in whenever. It's interesting. I don't know if it's like a hating women thing or like a competitive thing, should I say, not hating women, but like a competitive thing. I've met women like that seem to like fucking hate all other women and treat them very differently to like guys. I don't know if it's well, I feel like I can't interrupt him even though I disagree because he's actually trans. I don't know what it is. It's just interesting to me. And no one else is really interrupting each other. So I guess Tali is like, has been interrupting her back, but it seems to have started one way,
People that you're talking about, Kyla, for example, the anecdotes that I do take seriously, I think it's very likely, especially if they're your friends, that they are thoughtful, curious people, and the exploration that they did was patient-led. They wanted to delve into their psyche and understand why they're feeling these things and if this is going to be the right path for them. But the overwhelming, again, this is just what's happening. So there are obviously people who are bucking this trend. If you go into more conservative or even anti-trans places, yeah, they're a lot less likely to just affirm you. That's absolutely true. I don't deny this at all. There's going to be older psychologists and therapists, like generationally, like boomers, who are just not up to date on this stuff, and they're going to be more likely to explore or whatever. There are a growing number of gender critical therapists who have their own biases against any type of transition. And
Rick hardly ever interrupts Kyla, often asks for her opinion more than anyone else. So I mean, out of any of them that he might be friends with, it's going to be like her most of all. They both used to get the PV bucks and all that shit.
They're more likely to do explorative therapy. But if you want proof that exploratory...
Like, she's probably a big part of the lifeblood of his channel now. Like, I don't know who remembers, like, all these, like, fucking debate panels from years ago. Like, Wick was kind of the tail end of that. You had Dylan Burns, you had Prime Kais. The big streamers were, like, the lifeblood of these people. The idea should have been, like, oh, to get, like, more leftist, like, debaters can get their start here. But no, all it was just people tuning in to watch Destiny scream at a bunch of fucking nobodies. Or, like, Vorsh get fucking battered around by about 20 people because he can't finish a sentence in fucking less than 10 minutes. Or whatever the fuck. So these people end up being, like, the lifeblood. Like, Erudite's, like, the big name now because I guess Destiny doesn't do this kind of shit anymore.
Therapy, this is not great proof, so this is a little tongue-in-cheek, but if you want proof that exploratory therapy...
Yeah, Prime Kais sucked. He was a terrible moderator. He always had about 15 people on at any one given time. So someone would say something, 20 people would all fucking jump in at the same time. Eventually one of them speaks, and then all the people fucking jump in again. And then Prime Kais holds the pan up for fucking 10 minutes to give his opinion that no one asked for. It was fucking dog shit. But hey, listen, I used to eat that shit up, so hey.
is not happening regularly in trans affirmative healthcare. Go into a trans community and ask them what they think about exploratory therapy. Exploratory therapy is a slur in trans communities. It is a
yes, it's literally conversion therapy to these people.
Slur synonymous with conversion therapy. I'm not being hyperbolic. I wish I were being hyperbolic.
And I'd be willing to grant that the kind of trans people that hang out around Erudite, they're probably not quite the same as like the average TRA type. I don't think her sample is entirely like indicative of like the people like setting the tone of these conversations and the one pushing the rhetoric that ultimately she still comes back around to using anyway.
I'm not.
Just to be clear, I'm not here to defend crazy trans communities. I'll be the first to tell you that trans communities are fucking crazy, right? Lots of people.
But the crazy trans communities have infiltrated WPATH and the APA.
Yes. And she's still using their talking points. You hate crazy trans communities. Yeah, you're talking about the regret rate of hip replacements versus like trans healthcare. Where do you think these fucking talking points come from, you dumb fuck?
The issue is that WPATH and the APA have third-party things that they are required to be honoring to, that they can't just do insane shit all the time, or they're going to be liable for it. If it is the case,
The WPATH does not have any type of.
I'm just going to talk over you now, Tally, if you keep talking over me all the time.
What the?
If it is the case,
The WPATH does not have any type of.
I'm just going to talk over you now, Tally, if you keep talking over me all the time.
What the fuck is going on?
If it is the case that WPATH and the APA are just doing all these things that are
Triggered.
definitionally harmful to children, that the systems.
Oh, is that my Discord? Why would it be my Discord? I don't think it's mine. I think it's someone else's. Are you sure it's not like Wix or something like that? I think it might be Wix. Because it's not doing it now.
Rates would be so much, and the APA are just doing all these things that are definitionally harmful to children, that the desistance rates would be so much higher if we allowed it to be. The reality is that the evidence would be there. We would be finding this at large numbers, because when institutions fail at such a massive degree and such a large scale, you see the effects of it. You can see this when you look at there was multiple studies on workers that didn't have access to safety gear that were getting major cancers and health issues within 2 to 5 years of working there, right? When there are systemic issues at a system level that are failing people, you will see evidence of it. And I'm not saying that trans communities aren't fucking insane. I agree with that. In fact, they don't like my position either, and I'm obviously
Well, you clearly like theirs because you're using some of their talking points.
very pro them. So I'm not going to be here defending them and saying any of this shit. I wouldn't be surprised that APA conferences are saying this shit, because holy
The guy in the propeller hat's name is Soy Pill. I saw him on one other thing and he was okay, I guess. But he's a standard stock ally. The evidence is there. Erudite just won't read the WPATH files. Yeah, well, this is the problem. People on different sides are privy to different evidence, and the other sides just besmirch any evidence that disagrees with them without actually looking at any of it, or assuming it must be bad faith when it doesn't agree with them or some shit. It's tiring. We need to find some way of getting other sides to look at all the available evidence and not just what agrees with them.
fuck, I would never be at a conference as an APA person and say anything but that, because they're fucking cowards. But this doesn't mean that this is what it looks like in the practice. Sure, it is probably the case that the people in my community are going to be selection biased to be more interested in.
Oh, so she's even acknowledging it. I guess that's why Paggy said that earlier. Fair enough. Yeah. You've seen ahead, haven't you?
Thinking in general, and I'll just grant you that. But if what was happening right now was so...
Yeah, so it's not... So how are you using them as an anecdote, knowing that they're not really like the average, and that most of these people just show up. I want to be trans. I want to transition. Well, there you go.
bad and was harmful to people in such a significant way, I think that we would see these numbers. I think we would be seeing the effects of this, and that's the thing that I'm not seeing.
Okay. So first of all, this has been a pretty robust debate. It's mostly calm, actually, but we got a little spice there at the end. I've got some super chats to go through, and then we're going to close out and get to closing statements, and everyone can have their final arguments and tell people where to find you. But we're not ending the stream after we end the panel, because apparently Israel has started striking at Iran's nuclear facilities.
Typed it in a chat room. Okay, fair enough.
And we're going to cover that a little bit. So
is that what she's doing? Looking for arguments in chat.
That.
Wowie.
Stay tuned for that, okay? And if you guys
I get your menorah out.
Yeah, channel the dreidel powers and stuff like that. Okay.
Look, Iran and Israel can hash it out. I don't know.
But let's read some of these super chats and discuss them, and we'll get through it. $10 from Greg Yo. Say, could the panel explain a bit about how the medical process works? How many doctors are involved? What interventions are recommended and when? What sort of support and counseling?
Didn't we already do all this? I'm sure Aaron kind of went into this a while ago.
Is available, etc. Thank you for the $10. I think we've covered that.
Hasn't seen Marcy Bowers talk about puberty blockers either. Most likely not. Or has some kind of way of explaining it away. You can never tell whether they've seen stuff but the cognitive dissonance kicks in, or whether they only see stuff that affirms their shit because they have a certain kind of audience or a certain kind of community.
That excessively during this debate.
Well, in that chatter's defense, it does vary by country, by city, that's why
in the US it varies by loads of stuff because it's decentralized, right?
Like clinic down the road.
Yeah, and clinic, right? So it's
by clinic, yeah.
It's not always like 2 doctors and 2 therapies, right? Like this is very different for a bunch of very different things, and that's why there's never really like one answer for this. And maybe there should be, or maybe you can kind of get that way.
Well, overwhelmingly, we can still say they use an affirmative model. Their job is to help the child or person transition when they say, I am trans. We can say that, you know?
Move closer to something, but there isn't a solid one. So
Okay.
Typically, there's multiple standards.
Why are we letting this guy answer that question? There's a fucking trans person right there. Why is this guy the one answering that?
I even looked up like the American process. By and large, you can't get hormones same day, especially as teens, right? Typically, you have to go through multiple checks of like approval. They might argue that the checks of approval are insufficient and biased, and I think that's totally fine. But there just are these.
Or maybe straight up ignored by certain clinics that want the money. Or have some kind of weird agenda where they think that, I mean, listen, like, they treat things like puberty blockers and like transition as like time sensitive, where someone will present with all kinds of other problems, but they still forge on ahead as fast as they can with the transition. Again, like read the WPATH files.
Obstacles to overcome, and I would suspect that the obstacles and the wait times that
like Erudite is practically acting as some kind of PR agent for the status quo of trans healthcare right now.
Exist even in America that are pretty astronomical alone are going to probably account for why some of the people who finally get on the puberty blockers are probably already selection biased for the people who are already most likely to want to transition the full way through. Not that I think just delay of care should be the process by which we're vetting out people. I would agree that there should be higher protocol of vetting out people, and I wouldn't be surprised if it isn't.
How come there are videos of teen girls getting testosterone from Planned Parenthood same day? Because Erudite doesn't know what the fuck she's talking about, that's why. She's a fucking shill for the status quo at this point. This is how it already works, and our position is just to defend it ad nauseum, even with arguments that make no fucking sense.
Isn't where I would like it to be, particularly with teens.
Okay. £5 from Jacob Buckingham, probably the most British name we have. Says this: nice to see a discussion that isn't the typical "it's immoral" or delusion you get from the Daily Wire types. Thanks to all of you. Well, thank you, James Buckingham. $10 from Alexander Rin to say, does the social pressure against studies that found negative results from transition exist in other areas of medicine?
I think it's hard to compare those things. I'm sure that they do exist, but like the politicization of transness is not really comparable to a lot of other medical things. I think vaccines would be maybe the closest thing. And again, it's an argument for being anti-intellectual. Like, yeah, you do see sometimes that people won't release data that they might think would hurt a community, but the reason it comes out is because it's not like they just burn all the files. It's like, hey, we're not going to like go to all the like science journalists, or hey, like we might not make as big of a stink about this, and not, oh, like every single study that shows that actually the suicidality isn't going down, the quality of life isn't going down. They just like throw all those away because they're scared of hurting the trans community. I don't believe that's happening. Although they're.
He doesn't believe that's happening. Do you know that's not happening? What's your evidence to not believe that that's happening?
Obviously, is bias in this to an extent.
$5. Oh, I'm sorry, $10 from Alexander Wren. He gave me another $10. Thank you. How do you expect kids to figure things out if puberty blockers are also slowing or blocking brain development?
Great question.
My understanding of the evidence of like the stopping brain development is a little bit like wishy-washy. I don't actually know to what degree it's actually
now the evidence is wishy-washy. Gotcha.
stopping brain development. And the idea, again, you would have to show that even if there's like brain development being delayed, if there is it specifically in a way that's irreversible? And secondly, is it in a way that would presumably make us believe that they can't make decisions about their gender, right?
Yeah, like
you can be like
frontal lobe or something.
10-year-olds can make decisions on things that 14-year-olds can and can't, right? Like there's things we allow 10-year-olds to approve to because 10-year-olds can understand.
Can 10-year-olds decide whether they're ever having their own naturally born children?
So like the
Can 10-year-olds decide that they're fine being male but not having a penis and growing breasts?
brain development alone, I don't think is like fully sufficient. And again, not sure if there's evidence for what you're saying.
I don't think either way it makes any difference. I don't think it matters if the puberty blockers are like affecting your brain to that extent or not. They're children. You know, I mean, they're fucking children.
Well, and I think there's truth to the idea that like different people have varying levels of cognitive abilities. And this is a conversation that I have with a young trans friend of mine who is pro youth intervention. And she says,
exactly what a 10-year-old can give consent to. Well, yeah, exactly. How much permanence does a 10-year-old have? How many people decide what job they're going to have when they're 10 and actually stick to it? Probably a few, but not that many. How many people knew they wanted kids from the age of 10 or knew they didn't want kids from the age of 10 and stuck to it? Not many people. How could blocking puberty not block the brain development of puberty? Well, yeah, it kind of has to, doesn't it? But to me, it's like either way, that doesn't fucking matter. These people are too young irrespective of that, in my opinion.
All the time, like if a 16-year-old is cognitively able to consent and to understand the risks, that should be good enough. And while I understand that, I think that's somewhat compelling. It's still the fact that they are like too young to make these decisions for the rest of their life, especially if we're talking about things like foregoing fertility and things like this into the future. So my concern is still not just about how smart any one individual young person is, but the long-term implications that time allows you to consider.
Okay. $5 from Audacity to say, yeah, we're exploring therapy, all right. Exploring around till we find the doctor that agreed to give us the treatment we want. Thank you for the fun.
That's very true. Listen, that's the other thing. And I guess there's a problem everywhere to an extent, but I would imagine it's worse in America. You go to a doctor who's not going to immediately affirm you as a trans person, and you know that you're trans and you want that care. What's stopping you just going to a different one? Doctor shopping, you know what I mean?
$5.
I just
Like this whole like, it's not as robust as someone like Erudite thinks it is. I'm sorry.
want to say,
Well,
like the way
that's
that some
not
of
a
these people are-
trans unique issue.
Yeah, I was gonna say
It's not a trans unique issue, but it's something that is an issue with transitioning medically through a doctor.
the way that people are making it sound with the trans stuff, and I don't think this is borne out, is like, I don't know if anyone here lived in California back before 2018 when weed was legalized, but you had these like clinics on Venice Beach that were like, it's a doctor, and I guess they were medically licensed, who would just,
Oh, this is going to be a really stupid analogy, isn't it?
you know, you go in and you'd be like, my back hurts, and they're like, cool, here's your weed card. And I don't think this is the way that this is happening with trans people, or at least I
Yes, it's a stupid analogy. What has this got to do with anything?
haven't seen the evidence of that. Although maybe
You haven't seen the evidence for anything, you dumb fuck.
people do shop around because they really care about getting their gender affirming care, and some people push back more than the ones that they would otherwise want. I don't know.
Okay. $10. And this is from Alexander.
I don't know why this guy is here at this point. Oh, like, maybe that's happening somewhere, but I just don't think it's happening in general. Oh, well, you know, whatever reason I need to fucking stick to the status quo and say that nothing needs to change, even though there's fucking problems. Doesn't matter what anyone says, just bat it back. Oh, well, you know, I'm sure that's happening, but I don't feel like it really needs to change or anything, you know?
To Not So Erudite directly. Say, at Not So Erudite, what percentage of the therapists that are going to be highly recommended are going to be doing proper therapy versus pushing them towards exploring transness?
I don't even know if there's
James Linehan. I have to look into that.
like data that we would know the answer to that. And I don't know what you even mean by highly recommended. Highly recommended by APA, then they're probably decently scrupulous because the APA is recommending them. Highly recommended by like your local.
Again, this kind of, well, if the major medical organization stuff, it must be fine. They're very scrupulous. APA is like captured as fuck and refers back to WPATH. Mojito. No, I've got mango matcha, Charlie said it was. Very nice.
Local trans mom, probably less scrupulous. That would be my suspicion.
Okay. And then
Like, you're just making that up. What's the big organization? They're probably right. What's that based on? The fact that it's a big organization. What if they're wrong?
finally, $5 from Minerva's Miscellaneous. Exploratory therapy, quote unquote, can often be a Mott and Bailey for let's search for trauma forever and never allow you HRT access, end quote. Thank you for the $5. Okay, with that said, and with that gone through, I'd like to thank everyone for this debate. If you've enjoyed this, hit that like button, hit that subscribe button. We got some great stuff. And again, we're not ending the stream after the conclusion, so don't go away. What we got coming up? So on tomorrow, I have a twofer. Irrelevant versus Admiral Gibbs, and Tali will be joining me. She's going to be co-hosting this. And we're going to be debating riots and the LA riot situation. That should be fun. On Sunday, we have Hutch coming on with Staxiums, and they're going to be
Oh, Hutch is another status quo shill fucking loser on this issue.
fighting against Charlie and her friend, who think that the violence and the looting is perfectly acceptable, and people pushing back against it are just soy boys. Sorry, no offense, soy pill, right?
I
And
have
so,
to make a call after this. I didn't know Charlie was on that side. Yeah.
so yeah, well, she is. But we're gonna talk about it. So tune in, and it's gonna be great. And that's what we got. But I'm gonna give Aaron the first word, soy pill the last word. Aaron, close us out. Tell people where we can find you, and what are your closing thoughts on this? Go ahead, please.
You can find me mostly on X, formerly Twitter, as Allegation Vein. I also have a Substack that I'm not super active on lately, and then also the Naval Gaze podcast that Tali and I do together. Final words is just, I think before we kind of move further in what it is that what you've provided as far as trans affirming healthcare, we should find out what trans even is, and I'd just like to request research into what gender dysphoria is, what it is these doctors are treating, because they don't know, they're just prescribing because that's all they're allowed to do.
Okay, well, thank you again for being here. Really appreciate it. Check them out, gang. Not so erudite, please.
Yeah. Let's trans your kids, guys. My name is Not So Erudite. You can find me everywhere at Not So Erudite. YouTube, Twitch, Kick, all the like, Twitter. and in your mom's bedroom at least every Thursday.
Yeah, well, thank you for being here, and appreciate you. Go check her
So like cool and edgy, right? So like disconnected, like whatever. Jeez.
out, gang. She's great. Links to all these people are in my YouTube description. Tali, please.
Thank you guys for a great discussion. Kyla, I'm sorry for talking over you so much. It's a bad habit of mine. But hopefully we can talk again. I would love to go even further into this with you if you're interested. I think you're a very competent person to discuss all this stuff with. The reason I'm so excited for this conversation.
There's too much ass kissing here. Kyla isn't competent. She's just repeating talking points. She just puts a few more words in there than the average person does. But it's just talking points.
And one reason I think it went really well is because so much of this conversation is had by the freaks and the bigots and the extremists, right? Kyla, you commented on how a lot of trans activists can be really crazy, and a lot of the anti-trans activists are really crazy. Even the ones who call themselves feminists, even the ones who call themselves pro-gay and stuff like that, people have lost their fucking minds, which is why Aaron and I really don't have friends in the gender critical space much anymore. So I'm desperately trying to reclaim this conversation by moderate, sensible people who care about the well-being of trans people, so that we can get to an end state that is optimal for all people with gender dysphoria. Something we didn't get to talk about much is the fact that a lot of people with gender dysphoria can live happy, satisfied lives without a full transition. There are people who just take HRT but live in their birth sex. There are people who really can sort of accommodate with a social transition minus the change of pronouns and stuff like this. And these are all things that really should be explored if we're looking at the best possible outcomes for dysphoric and trans people.
Okay, thanks for being here, gang. You can check her out on The Navel Gaze and my show, where we host a show probably every week. So we don't have a name for it. If you want to give a name for it, please suggest good ones because we can't think of one. Last but certainly not least, the man, the myth, the legend, Soy Pill. Go ahead.
Yeah, I'm Soy Pill. I make video essays. You can find me on YouTube, apparently Twitch now, because I co-stream, and Twitter, the only acceptable thing to dead name. I just want to say thank you to everyone here. This was probably the best and last most good faith debate I've ever had, where everyone was very vehemently engaging, acknowledging the points of the other people and clarifying, and no one was mean or rude, and everyone was listening. This is never going to happen again. This is like a miracle lightning in a bottle. It's like a Lord of the Rings film. So I appreciate you guys. And sorry, chat, that I didn't scream at anyone. But yeah, my points really haven't changed from the intro. I still,
Of course they haven't changed in the intro.
have yet to see the evidence that this is some horrible, harmful thing that is happening. I think it's great that we all agree that there should be good checks to making sure that anything that could otherwise cause harm because it's not reversible does have some sort of exploratory therapy or some.
Which it doesn't. But when people tell you, you just ignore them. Well, I haven't seen evidence of that. You haven't seen evidence of them not using exploratory therapy.
Sort of like medical, assessment, which is hard because it's a medical thing, or it's a thing in your brain. So it's going to be a difficult thing, but I'm glad that at least everyone on this
Yeah, erudite is like kind of skinwalking destiny in a lot of these fucking debates. Let's be real. Let's be fucking real.
panel agrees that to some degree, these people are happier, and these people should be able to get this care. It should not be barred forever. Maybe it should be harder in certain circumstances. That's cool. I'm very happy. Kyla, I agree. Trans communities are insanely based. I'll say that because they're all so cool. So thank you very much, everyone. Thanks, Rick, for having me.
Okay, thanks for being here, gang. I'm going to move you all out.